Good afternoon and welcome everyone on this pleasant day. We are indeed glad to have you all join us for this conference. At the outset, I hope that you and your families are doing good and taking care of yourself. I'm Swati Agarwal from FICCI Life Sciences team. The best healthcare plan is a self-care plan. This famous quote has become all the more relevant in these unfortunate times when large part of the world is grappling with unprecedented crisis of COVID-19. Our understanding of the virus and the disease and how we manage it is evolving every day. The crisis has multidimensional impact on our lives, including health, well-being, economy, geopolitics, the way we work, the kids, their schooling, and etc. The impact of new normal will be long-lasting and will require a holistic review of our policies and regulatory framework. Health and hygiene have emerged as important areas to focus on and taken the center stage in our lives to cope up with the crisis. Now, more than ever, practicing self-care is essential because many of us are self-isolating or in quarantine at home. Now, what is self-care? Your ability to promote health, prevent disease, maintain health, and cope with illness and disability with or without the support of a healthcare provider is known as self-care. Considering the importance of self-care, this online conference assumes a great significance. I'm happy that we have such eminent experts from this domain today with us to share their thoughts. Today, as part of this conference, we'll get an opportunity to hear perspectives of government officials, industry experts from India and abroad. This will be followed up by a panel discussion on self-care, the foundation of India being self-reliant, Atmanirbhar. So without further ado, I would like to invite Mr. Dilip Chinoy, Secretary General FICCI, to deliver the welcome address. Sir, over to you.
So good afternoon to all. Very warm welcome to this session on self-care for a self-reliant India. I think, I'm reminded of this famous thing, all of us have traveled by air. So whenever the demonstration is done and they say the oxygen mask will come out and they instruct us that first put on your own oxygen mask before helping others. And I believe that is the fundamental principle of self-care, because if we ourselves are not, fully fit and protected, we are not in a position to actually take care of others. And therefore, it is indeed, a great pleasure to welcome each one of you to this special webinar. I would like to begin by adding to what Swati said. I hope that all of you are keeping well and keeping safe. Please do take self-care of yourself and look after others around you. A special warm welcome to all of the officials from government, the team from Bayer Consumer Health, and of course, later we will be joined by the Director General Association, the European self-care industry. A very warm welcome to all the participants who have joined us. Your joining this webinar, first of all, demonstrates your belief that you believe in self-care for a self-reliant India, and thank you very much. I think as we continue to combat the COVID-19 pandemic, we must also accelerate momentum of responsible self-care so that people can proactively take charge of their health, both in terms of preventive measures and treating minor illnesses. One of the key parameters of self-care, I think that we need to advocate amongst others, is to dispel this notion of vaccine hesitancy. A lot of people believe that taking a vaccine could do a lot of other things other than prevent them from being infected. So in this thing, the number one aspect and number one message I want to give to everybody is please If you're eligible, book your slot for vaccination. If it is a few days away, don't get impatient, but also encourage others to get themselves vaccinated. I think the important point of self-care and preventive healthcare is to lessen the burden on the health system, one. Second is actually looking at our own selves and our own health expenditures. We can drastically, improve the state of our own health and also reduce the medical expenditure on ourselves and our families if we actually go down this route. By promoting proactive health-seeking behaviors, India's large working population, which is going to be the largest in the world by 2027, can benefit from bolstered productivity as a result of reduction in lost labor time, reduced time for in-clinic visits, along with lowered hospital costs. I would like to thank our partners, Bayer, for actually partnering us in this and doing this program. Incidentally, today is the World Cycle Day as well, so that's another way of exercising and keeping safe. We are committed to challenging our collective efforts to get India back on its feet and the foundation of self-reliance or Atmanirbharta through self-care in India. I would like to thank all of them for joining, and I look forward to the discussions here because this is one of the rare occasions where the outcome is actually directly beneficial to all of us, including me who are attending. So thank you very much, and back to you, Swati.
Thank you, sir, for the welcome address. We now have a keynote address, Rebooting India through Self-Care by Mr. Sandeep Verma. Sandeep Verma is the country head of Bayer's Consumer Health Division in India. He has over 20 years of FMCG industry experience working in organizations like Unilever across diverse roles in sales, brand management, category management, and various P&L stints, handling multiple brands categories across the globe. Sandeep has been involved with the health and hygiene categories in FMCG for last 10 years. Welcome you, Sandeep, and request you for your session.
Thank you so much, Swati, for having me here, and thank you so much, Mr. Chinoy, for having us on this forum. I will definitely remember the example you gave on the oxygen mask and shamelessly copy it in many forums where we go to evangelize the cause of self-care itself. So thanks a lot for that. Let me just share my presentation. Is my screen visible?
Yes, visible.
Yes, it is visible.
Okay, thanks a lot well, thank you everyone for being here, all the participants and all the audience. I think the country is really going through very, very troubled times right now. And in these troubled times, the word reboot really comes into the picture even more. When we reboot a system, when we reboot a computers, when we reboot a cells, what emerges after the reboot is a new version, is a new, more advanced version, and a version that is better suited to address all the challenges. And that's what we want to do in India as well. We now have the opportunity of relooking at the entire healthcare landscape in this country. And we believe that self-care can play a very, very important role in redefining the healthcare landscape of this country. So coming very quickly to what we call, what we see the role of self-care. So I think on the right side of the slide, you can see what is called the self-care iceberg. So essentially, if you divide the entire healthcare spectrum into primary, secondary, and tertiary care, self-care is that hidden part of the iceberg which still needs to be discovered. And on one side of the axis, you have the which go from low to high as you move from self-care to tertiary care. And on the other side of the axis, you have the frequency of need. So obviously, you need a lot more of self-care. So the frequency of self-care interventions is high, and tertiary care is obviously the lowest. So this is what is called the self-care iceberg, and it truly defines the potential and the role that self-care can play. Like Mr. Chunai was just saying, if done rightly and if done timely, self-care can help us with firstly propelling us faster towards our own goals, and of course, it can reduce the burden on the country's healthcare system. So to reduce the stress on the overall healthcare and parallelly also ensure that we are able to win this war, we are able to reboot this country, not by giving up on our dreams, but by actually accelerating towards them. Self-care has a very critical role to play. Now, yeah, coming very quickly to what it is that I'll be sharing with you guys in this presentation. 4 things. Let's first talk about the consumers. What are the dreams, the challenges, the role and the connection of self-care and productivity. India Self-Care Council, which is an initiative that we've taken, which I'm going to be talking to you about, and the 3 pillars on the India Self-Care Council that we want to share with you guys. So India, as we all know, it's a land of a billion dreams. In fact, it's a land of 1.4 billion dreams. We are definitely dream rich, but we are also definitely health poor. Just to give you some consumer insights and some perspectives, these are the kind of headlines that all of us like to see and be very proud of. So doing better in life, scaling up my living standards, having a better future for myself versus my yesterday is something that drives all human beings, but it drives Indians even more. Yeah. As a result, to fulfill our dream, we tend to work more and harder than the others. So India is actually, some of you may know this, some of you may find this surprising. India is actually one of the most workaholic nations in the world. It comes in the top 5 most workaholic nations in the world. We put in longer hours at work. And right now, just visualize yourself. Visualize the people around you in your office, and see if all of what I'm saying is actually correct or it doesn't hold true. And I will see a lot of heads nodding and saying yes. So we definitely put in longer hours. We put in more effort. We are guilty of taking lesser leaves. And I think Indians are the most open to work on holidays, weekends, etc. So in general, to fulfill our dreams, we just tend to go a little bit overboard at times. And the reason for that is that all of us are sort of born with this huge chip of responsibility on a shoulder. And responsibilities for us are so important that we continue to work, even with health niggles. So we work through headaches, we work through fatigue, we work through back pain, allergies, fungal infections, etc. No matter what we are facing, we often show up and work. And there is a study which was done on, which is called the GSK Pain Index report, which says that half of the body pain sufferers in India actually work regularly through body pain without even taking medication. And similarly, amongst the head pain sufferers, 40% of the head pain sufferers continue to work through their head pain. So we are essentially a country that prides itself on a resilience, and we take some of this suffering as a badge of honor that we put on ourselves. Now, obviously, because we work with the ill health, we started to live with our ill health, and this will have consequences. What we do not realize is that working sometimes in this kind of a suboptimal manner only results in a depleted productivity. So there was a study which was published in the Lancet journal, which actually says that an average Indian's peak productive period lasts only 7 years. Okay, it's almost half of Sri Lanka, and it's much lower than half of countries like China, etc. Now, this obviously has a direct connection with all the 3 points which I was just talking to you guys about. Now, but the question is, why is it so, and why do we don't take any action about these kind of health niggles despite the discomfort that we're actually facing? So there are 3 points which emerge very clearly. First, obviously, is a lack of awareness of the magnitude of the problem itself. So we take a lot of these things very, very lightly. simply because we're not aware of how big it can actually become. Secondly, a lot of times we don't even understand that it could be a health issue. If I'm not able to, climb up the stairs today, I may not understand that it could be a challenge with the iron, with the content of iron in my body. I would just knock it off to, oh, it's just one of those days, etc. So many believe that it's a very simple daily irritant and not a health issue. So these are the two very, very big reasons, but probably the biggest reason of them all is the knowledge gap. It's the knowledge gap on self-care. It's the knowledge gap on how to take care of oneself that makes them hesitant. There was a study that Bayer itself conducted in India, which says that more than 3/4 of the consumers, 3/4 of the people think that even amongst the advertised self-care products, they do not get full product information. And almost 90% of the consumers actually seek more information from their chemist on things like dosage, on things like mode of administration, etc. And we have a lot of these kind of verbatims, about people not taking allergy medication, simply because they feel that it's going to make them drowsy. Not taking a headache medication because they feel that it will have an impact on their kidney. So there is a big knowledge gap which exists. Now that is actually worsened by the fact that there is a lot of information which is right now available online. This information can be very overwhelming. For a simple leg ache, it can give you treatment for an inflammation to bone cancer. It can be very complex and you may not be able to understand it, and it will obviously be very conflicting because it's not personalized. So that's one challenge with the information, with this glut of information which is available online. And I think the second challenge with the information available is regarding the social media and the blog and something called the WhatsApp University, which all of us are aware of, which actually give you opinion-based information, which is again impersonal and also very, very unstructured. So the fact is that there is a lot of data available today in the market, okay, but whether that's the right information is the question mark. And that is what constitutes to this whole challenge on self-care and not practicing too much of self-care. So we feel that it's critical to bridge this awareness, knowledge, and understanding gap. Only then will people get the confidence to self-care, which in turn will bolster their productivity. So these are the three key variables of awareness, knowledge, and understanding which need to be bridged. And that's why we at Bayer Consumer Health are proposing the creation of a body called the India Self-Care Council with the tagline of Sehat se badhega India, or stride forward with health, stride forward in life. Now, what's our vision on this one? Vision is very simple. We just want India to find its absolute peak productivity. Our mission will be to equip every Indian with the knowledge and access to self-care to overcome minor health hiccups. And the action that we will need to take, that we will be taking under this council to begin with, is to create this ecosystem of health, of self-care, to make Indians recognize and act on some of these minor health niggles. And we will do this by bringing in a lot of partners and obviously using technology. So in effect, the Self-Care Council is like an ecosystem. It's a self-care ecosystem, which will have media partners, which will have knowledge partners, which will have obviously have industry partners, inter-industry, intra-industry, and it will also have digital partners. One of the things that we are very clearly saying here is that if we really have to reboot India, it will take the collective might of all of us to do that. One company cannot do it. One industry also cannot do it. It will need to take industry, government, knowledge partners, digital technology partners, media, everyone. But I think this is the right time to press the reboot button. Fate, unfortunately, has given us this, given us this opportunity, you can call it. But if we do this now, we will be in a much better shape, and we will actually propel forward with all our individual goals. Now, what are the three core pillars on this ecosystem, and what are we going to do in this ecosystem? Essentially, the three core pillars are what we call ask, know, and act. Asking is really the first step towards taking control of your health. If you do not ask the right questions itself, you can't move forward. So we will encourage people, consumers, to ask about their health niggles, to seek information from our platforms. We will open people's eyes by provoking them with self-care and productivity data, triggering and hence trigger this curiosity to ask. No is the other pillar, where we are saying that we will provide them with awareness, knowledge, and understanding about the importance of self-care and the connection of that with productivity. We will try and break a lot of the medication and self-care misconceptions and arm people with the right kind of information. And finally, probably the most important of these three pillars, getting people to act, which is also the most difficult pillar amongst these three, because it constitutes a complete behavioral change. So we will try, basis the questions asked and basis the information given, we will try and change the behavior pattern of people so that they become more self-care savvy. We are already seeing a big shift in the whole paradigm of preventive healthcare post-COVID. It is largely driven by fear, but we feel that it can also be driven by a more positive sentiment of attaining one's goals optimally. So we have multiple ideas on what we can do here, but these would be the three core pillars on our ecosystem going forward. It's going to be like a multi-year effort of sorts. So in year one, in the first year of India Self-Care Council, our mission will be literally to get India back on its feet. So we will try and get Indians to fight back the lasting effects of the pandemic. Mr. Chennai spoke about the vaccine hesitancy. We will make the people get back to their physical, mental, and emotional health and resume with the same health and productivity. So I think that's going to be the key thing on year one. And going forward, we will talk a little bit more about what it is that the Self-Care Council can do. So just my last slide, just my closing slide on how all of this will help. Well, firstly, it will promote the cause of self-care as a means to enhance the productivity of all Indians. It will help us to democratize access to everyday health solutions to underserved consumers. This is another big challenge in this country, that a lot of the initiatives taken are, do not reach the underserved consumers in the semi-urban and rural India. So we hope that this will help us do that. And of course, it will help us to set the foundation of this self-reliant India or Atmanirbhar Bharat, and help the self-care industry participate in this thing altogether. So that's all that I had to say. Thank you so much for a very patient listening. I hope my Wi-Fi was good enough and you guys were able to hear everything I had to say. So thank you so much.
We're able to hear you, Sandeep, very clearly. And thank you so much for re-emphasizing the role of self-care in today's world. And very happy and excited to see the initiative for Self-Care Council. Congratulations for that. We now move to our special address, the role of self-care to boost productivity. To deliver the address, we have with us Ms. Urate Schwarkaite, Director General, Association of the European Self-Care Industry, AESGP. As Director General, Ms. Urate is responsible for providing strategic direction and leadership while managing the day-to-day operations of Association of the European Self-Care Industry and its ongoing relationships with its member associations, companies, and other stakeholders, as well as representing the self-care industry in various international, European, and national forums. The Association of the European Self-Care Industry represents the manufacturers of non-prescription medicines, food supplements, and self-care medical devices in Europe, an area also referred to as consumer healthcare products. Dear Urate, it's a pleasure to have you with us today, and over to you.
Can you hear me, please?
Yes, we can hear you. Yeah.
Sorry. Usual hiccups with the technology. First of all, thank you very much for having me in the forum today. It's a great pleasure to come and share our self-care journey in Europe, in the European region, which is the scope of the ASGP association. We are an association of the association, so we bring together basically 23 country organizations and the company representation as well to work together towards one mission, which is to advance responsible self-care in the European region. And we do believe that we can do so by, first of all, enabling citizens to take better care of their health needs, and at the same time to contribute to the sustainability of European healthcare systems. So just a couple of numbers, because I mean, if you think Europe is sort of less than half of India in terms of the population, however, still we count that every second pack which is leaving European community pharmacies today normally will bear a non-prescription status. We see more than 1 billion packs of minerals and vitamins that are being purchased by the Europeans every year. And we maintain a list of INNs, or let's say active ingredients, that are available without prescription in Europe in our database. And we have more than 200 of those. And we also count more than 4,000 self-care products, so being it prescription, non-prescription medicines, food supplements, or medical devices, because we have 3 categories in Europe to cover those. And typical ailments that you could treat with the self-care products in Europe ranges from allergies, gastrointestinal disorders, cuts, bites, rashes, cough and cold, and also naturally pain, which is one of the primary categories that has sort of drove the self-care agenda. So before I dive into actually some of the data which I would like to share with you, I just want to share with you the strategy of the ASGP. So also a strategy of the self-care industry in Europe in how we want to achieve our vision and mission, which is to achieve more self-care in Europe. So first of all, we believe that it's important that we promote value and benefits of self-care. We also work actively on shaping a legislative and regulatory framework, because in order to have the offering of the products on the market, it's very important that the framework is there. We also build trust in the industry, and we also want to be recognized as responsible industry, and therefore some of those initiatives that you are launching today will resonate, and you will see during my presentation that some of them we are also doing in the European region. And also for us it's very important to strengthen a holistic network, so work with our partners that naturally would be the regulators, but also healthcare professionals, in particular pharmacists, as well as the doctors, in order to make sure that that self-care is practiced responsibly. One of the pillars for us in achieving the strategy is health literacy, because we believe it's a prerequisite for responsible self-care. We also are building, and this is also a strategic goal for organization, we are building and collecting data and evidence to support the necessary change and to support need for more self-care. And of course, we have a core values, which one of them is very important. So we are consumer-centric. So everything we do goes around actually the needs of the European citizens. So basically, to address or to build the evidence base in order to drive forward some of the agenda for more self-care in Europe, we have commissioned an economic study to look into what's the value of self-care products today in Europe, and what could be a potential value of self-care products in the future, and as well to look into how countries compare and what policies would support more self-care. So I'm very happy to share with you some of the preliminary findings, and I'm saying preliminary findings because the study is sort of almost there but hasn't been published. So you are the privileged audience today, which is going to see what the numbers are speaking before it's even published and disclosed to the European audience. Just a small remark regarding Europe. When we talk about Europe, at least for the purpose of this study, we mean 27 EU member states plus Norway, Switzerland, and UK. So when we did the economic study, last time we did a European economic study was back in 2004. So it was more than a time to review and to look into whether our contribution has remained the same, or actually we have been increasing our contribution to the individuals, but as well to the health systems and the economies. So our assumption when we were going for this study, and this complex figure can be explained very simply. If you have a minor ailment, such as a headache or cough or allergy, normally you have sort of two choices. Either you go and see a general practice doctor, or you are going to do a self-care. And in case of the self-care, sometimes you will be taking home remedies, and sometimes you are going to actually resort, very often go into a pharmacy and take some self-care products to manage your condition. As well, we are very much aware that most of the people actually will do nothing and wait and see how their symptoms are going to evolve. And they will maybe later on, if the symptoms persist or they get worse, they will actually take on the self-care journey, and they're going to either self-care or go and see the doctor. So basically in Europe, we calculate that 400 million Europeans that are basically today, they have collectively 6.6 billion minor ailments every year, out of which 1.2 they do actually take care of by taking the self-care products. So the rest of the cases either end up in GP's office, or I would say majority of them actually are left sort of for the scenario wait and see, and people simply do nothing. And in some cases it can be justified, but in some cases it's unnecessary suffering which can be prevented. So basically in this study, what we have done, we have compared the costs of the GP consultation versus a self-care. So actually taking a self-care product very often purchased from the pharmacy. And we have calculated, based on the numbers of the self-care products that we see being sold through the pharmacies mainly these days, how does it sort of translate in the economic parameters and how much of the savings we do generate. So we haven't done this for each European country, but we went and developed a model where we grouped European countries depending on certain criteria. And those criteria are, for example, time costs for seeing a GP, how much the 1 hour of the GP costs, also looking at sort of what could be the typical OTC packs that are being purchased compared to visiting a doctor, and also medication cost we also looked at. So this allowed us to group European countries into sort of 11 clusters. And you can see that, for example, cluster 5 has a lot of countries, where if you look at cluster 10, we have only Sweden there. So this is in order to make sure that we are talking and we are comparing apples with apples and peers with peers, rather than having a mix. Because obviously, depending on the purchasing power and depending on other parameters, as I just mentioned, the contribution will be very different. And indeed, what we found, and this is a figure which presents to you the difference between a self-care intervention versus actually the intervention of going into the GP's office. You can clearly see that there are huge financial differences in between the two. And the good news is that it's always cheaper to go and see, actually, to go and seek self-care yourself, rather than actually basically go and turn up into the GP's office. And you can see that the savings range between 11 euros to actually 41 euros if you choose self-care versus the going into the doctor's office. Going to the next slide. So basically, if we translate these global figures for 1.2 billion minor ailments into the financial figures, we have calculated that basically the savings for the health systems are around 23 billion euros in total European region. And then if you look at sort of what we save for the national economy, mainly because people do not miss work, because they need to go and consult their general practice doctor. This is another additional 10 billion euros, which we are saving today because we have access to the self-care products, and people do actually take care of themselves rather than use the healthcare system resources that I'm sure we became very aware during the COVID crisis are scarce wherever you are in the world. What is more important is that this figure translates into the sort of health system resources that otherwise we would need if the self-care products did not exist. So if today we had no self-care products that you could be easily accessing yourself for the self-treatment of the simple minor ailments, in Europe, we would need more than 120,000 extra general practice doctors, or otherwise those doctors that work today would need to work 2.4 hours longer working days every day. So I think this is a significant contribution if you think about self-care in Europe, that our industry sort of reduces the burden on the health systems. This translates, I'm talking only about global figures because as you have seen that depending on which country you are in, those savings are going to be different. So these are really global European figures, but they are still giving sort of an average estimate of what actually the self-care contribution is. So patients in Europe, on average, save 106 minutes per self-care, per treating self-care by self-care minor ailment compared to if they turned up in the GP's office. 22 of those minutes would be usually working time. So this is also a huge economical savings in terms of reducing absenteeism from work. And the economic value of this can be estimated to be €9.30. For the national economies, we calculated that about 12 minutes of absent from work payment is saved, and this translates to €4.84. So basically, we concluded that every case of self-care versus going to a doctor saves on average to the European economies 14.14 euros. And this is really huge. As I already said, we calculate that there's more around 6.6 billion minor ailments in Europe, and 1.2 is currently self-cared, which means that the rest of minor ailments are either being neglected or people actually are still turning up in the GP's offices. We believe that there is a huge potential to do more and to produce, further savings to the health systems, national economies, as well for the personal time of the patient. When we look into the self-care, how to make more of it, there are two parameters that it's important. So first one is obvious, to have more products that are available without the prescription, which we think about as a breadth of the self-care. And the other option is actually to enable more people to take care of their healthcare needs, basically replacing the GP consultations or nihilism by actually self-care, which we will refer to as depth of the self-care. So as you can see in this graph, there's a potential to go both ways in the depth and the breadth for most of the European countries. So this is a figure which I would like just to share to show you that sort of the depth of the self-care varies very much, where in Poland we see around 50% of people actually already doing self-care. And then if you actually look at Norway, we have the least uptake of the self-care, and the potential there for sort of doing more is really, really huge. When we looked at the modeling and we wanted to calculate what could be a potential savings for the European economies if more self-care was practiced and more products were available as OTC, we have split and we distributed the countries in this sort of a graph. So if you look at the horizontal axis, this is a number of OTC medicines available for self-treatment. And then if you look at the vertical axis, you see the depth of the self-care. So what is the percentage already of people practicing self-care versus either neglecting it or turning it in the GP's office? So you can also understand that you have a huge division in the potential, because in some countries, like for example, United Kingdom, which already has a very good depth and breadth, the potential is lower. When if you look into actually the country like, for example, Croatia, where you still have a huge potential for depth and breadth, because there are only few molecules available OTC currently. And also, if you look at the people taking care of themselves rather than doing something else, it's also a potential is huge. So therefore, there is a potential between 10% to 25%, depending on which country we are looking at, to do more self-care in Europe. So basically, we developed with this scenario, depending on the potential of each individual country. And this scenario has also gave us a number, which is 17.60 billion euros that could be further saved for national health systems, for the economies, but as well as for a personal time that could be actually released if more self-care was enabled by allowing more products to be self-care and also by empowering more people to do self-care. So I think if we would add it to what we currently save, this potential, we would arrive to 54 billion euros that we could be saving and putting back into national economies, but more importantly, releasing those that burden from the health systems in terms of, for example, the GP time. So if we look into the potential in relation to sort of healthcare system resources, if more self-care was practiced according to the scenario that we modeled through this study, there could be, we could reduce the need for 58,000 GPs in Europe, or otherwise those GPs that we have today could actually work 1 hour less per day, or otherwise spend this 1 hour to treat those more complex patients rather than headaches, coughs, and simple allergies that too often people still turn up to see a doctor. So I'm coming to an end of my talk, and I just want to share some of the insights how we see to move this needle forward, and how do we see in Europe that we could actually enable more self-care. And I think I would like to offer sort of 3 strategies, which one is definitely access. So it's having the right regulatory framework where we can have more products going OTC for those self-treatable and self-manageable conditions. In Europe, we still have a big difference between the countries in terms of those access, because if you have seen in Croatia, we have less than 50 molecules available as OTC. And then if you look in the United Kingdom, we have around 150. So I think there's still a huge potential to bridge this gap. And still in England, where you have 150 molecules available as OTC, in Europe as a whole, we have 200 molecules that could be an OTC. So still, even in the UK, you have a potential to grow the access to those products that can be purchased as an OTC. And a previous speaker before me talked about health literacy, and no surprise, in Europe, it's the same. Health literacy is one of the key drivers for more self-care. So it's about how do we equip the European citizens with the necessary skills to manage their health. And this is a very important element for us going forward. And I think we also see a huge potential in digital technologies. And we have seen this especially through the COVID, where diagnostic tools have been developed, where you could have symptom checkers for your COVID symptoms, etc. So we believe that digital technologies, which could enable people access to the information, access to diagnostics, could definitely of the care. And of course, the one important element in all of this is healthcare professional support, because without that, it would be very, very difficult to support people in their self-care journey. So before I conclude, I just wanted to share a couple of examples of successful self-care campaigns that we are extremely proud to present, being developed by our members. Before I conclude. So, of course, most of these campaigns have been developed in the collaboration with the pharmacists, because they are the key players for self-care journey. So one of the campaigns that we are mostly proud of is the one from Portugal. It's called Tratar de Mim. It's a campaign which was together with the health industry, also with the medicines regulator, and it has developed a set of information sheets on different minor ailments, ranging from headaches to cough and cold, accessible to general public, where people could read about the condition and also could read about their self-care options. Important thing which I wanted to share with you is that they also have developed a board game intended for kids, actually, which has been spread out through the Portuguese schools, where kids could learn about minor ailments and the treatment options. But this game has also been in particular successful also with the elderly people in the care homes, and it has been rewarded as a best enterprise communication project by the Portuguese government in 2016. Another one which is very interesting, and it goes back to actually collaboration with the Pharmacist. Croatian Association of Self-Medication Industry has supported development of the self-care manual for pharmacists by pharmacists, which has put together a very succinct content of the main and major minor ailments that can be self-treated and self-managed, together with the self-care options. And this has been sent to all the Croatian pharmacies. And now going forward, it has also been implemented and integrated in the dispensing software. So when the pharmacist is dispensing, he can always look up and see what could be the best self-care options for the patient which he or she has been consulting in the pharmacy. Another example very similar to the one in Portugal is coming from Greece. So this is a self-care campaign, again in collaboration with a pharmacist, which has produced a number of information which will be made available through pharmacies to the Greek population to inform them of their self-care options and also support them in the self-care journey with the relevant information. As well, there will be information campaign encouraging people to ask their pharmacist about their self-care options, because most of the products that are available self-care will be available through the pharmacies. Another interesting example coming from Ireland, our Irish Association, again, together with the Pharmacy Association, has been running a campaign, Be Well this summer. And then later on, they had a campaign, Be Well this winter, where they have been encouraging through the social media, to people to actually think pharmacy first and think about sort of self-care first when they have minor ailments. And then finally, one of the examples which is very seasonal is the UK Self-Care Forum. It's one of those countries that we look up in Europe in terms of self-care policy. So you see different materials produced by Self-Care Forum, which was supported initially by our member PAGB, but now has sort of its own feet and is working very well, which brings together various healthcare professionals, various experts in producing content to support healthcare professionals as general public to do more self-care. And it produces range of materials ranging from cough and cold and any other materials to support people in their self-care journey. So just to conclude, I think all the governments, no matter where in the world, are facing unprecedented concerns on the expenditure and healthcare costs. And I think COVID has also brought the health systems on their knees in terms of actually capacity to meet any increase in demand. And I think we still haven't faced the worst, because the aging population is a pressing matter which hasn't been addressed. We also know, and we have seen through the COVID, that citizens are willing and demanding more responsibility in their well-being and healthcare. We also know that technology has a potential to change delivery of healthcare. We have seen this already when the doctor's office had to close because of the risk of spread of infection. Telemedicine has taken over and quite successfully replaced a majority of face-to-face consultations. We do think that encouraging self-care is sort of an obvious choice for preventing ill health and treating suitable conditions. Health literacy is a key. Pharmacists are also a key because they're at the forefront of those changes, and I think they are the most frequently consulted healthcare professionals in the community that have the power to signpost and advise citizens in their self-care journey. And we do see self-care as a starting point in the healthcare is for sure no care, and this should become an integral part of national health policies. And we hope that it will be supported by the governments, and we see the change already happening in a number of the countries that we are representing. Thank you very much, and I hope I did not go over time too much.
Thank you, Ms. Urate, for such an informative address and sharing the results of the study with us. We already have a few questions for you from the audience. If you allow me to go through them and would love to hear your perspectives on them. So first question has come that is saying, what amongst the EU best practices around self-care initiatives would be a good fit for India, according to you?
So to be honest, I'm not sure if I'm the best to comment this because I do not know all the circumstances and all the context that you have in India. But building on the European sort of experience, because I think we also have a range of countries that are very different. But actually, when you look at what would fit and across possibility to sort of transfer best practices from one country to the other, it's actually not very difficult, and it's not there are no such barriers as we could imagine because the countries are different. So I would say that thinking about India and the little that I know about the country, health literacy seems to be a key in whatever market in a European country, but I guess also in India that you look at. And we really look and we try to actually sort of copy the Portuguese campaign, where you have a large public facing campaign aiming to increase health literacy. And we also have these innovative tools, like, for example, board games, materials made available through the pharmacies, going into the schools, going into the care homes. So I think this kind of thing where you could actually spread it throughout the community through different channels and through different delivery methods, like board games, for example. I think this seems to be as something which fits every European country possible, also in India. And also our Australian colleagues, for example, are also looking into implementing a very similar project.
Thank you. The next question which we have got is, what are the three major factors that are important to support self-care in any part of the world, according to you?
Yeah, so I think it goes back to what I already said. And first of all, of course, as an industry, because without the products, without self-care products, there is no self-care. So I think, first of all, we need a fit regulatory framework, which encourages innovation, which also recognizes innovation, for example, as digital. We see a number of companies now developing support tools, digital tools to accompany their products. But also the framework which allows more self-care options to be made available. So this is key, because if there's no self-care products, there's no self-care. And then also health literacy is another one, because I think we want to see responsible self-care. And I would say that another important point is support from the healthcare professionals, because we see that in those countries where pharmacists are actively encouraging self-care, where doctors are supporting self-care, the self-care is sort of at the high, and people are more confident to do self-care simply because their healthcare professionals also have been supporting them with the very similar messages.
Great. Thank you. So the last one which we have got is, so people have expressed concerns that if, self-care or self-medication could result into antibiotic resistance, which has been in talks of recently. So what is your viewpoint on that?
So we do actually believe that self-care helps to reduce antibiotic resistance, and simply by the fact that most of the cough and cold cases, so up to 80% of sinusitis and bronchitis, are actually viral. So people do not need antibiotics. What they need is they need a symptom control. So they need maybe a mucolytic, maybe they need actually antihistamine, or maybe they need something to sort of to treat the symptoms of the blocked nose. So really, if people had the right support to choose those products for symptom management, and if they had the information to say that average cough and cold can last from 2 to 4 weeks, and you just need to do self-care, there would be less demand for the antibiotic use. So I think if we were to increase the health literacy and to explain that what are viral infections and why actually most of the cough and colds are self-manageable and self-treatable with the symptom medication, we would have less demand for antibiotics, and we could contribute also as an industry in reducing and sort of curbing this very important public health threat that we all face globally.
Thank you, Ms. Hirate. I think that was very important what you brought out and very informative. Thank you so much. We now move to our next session. So unfortunately, Dr. V.G. Sumani, Drug Controller General of India, couldn't join us today. He has regretted at the last moment. He had got some important meeting at PMO. And hence, we are moving on to our next session, which is the Fireside Chat on India's OTC policy. For this, we have requested and we are glad to have Mr. N.K. Ahuja, Controller, Food and Drugs Administration, Haryana, and Chairman, OTC Subcommittee. With his role in the OTC Subcommittee, he has been instrumental in collecting the feedback from relevant stakeholders to work on the OTC guidelines for India. We all know that how many interactions we have been having with him, and he was always there to listen us and answer our queries and the industry's query so patiently. We welcome you, sir, to this conference. And to host this fireside chat, we have with us Mr. Arun Mishra. He is chair of FICCI OTC Task Force. Arun is a senior regulatory expert. He brings a strong, diverse international regulatory experience of over 20 years of India, Europe, and emerging markets, including Asia Pacific. Thank you, sir, and over to you, Arun.
Thank you very much, Swati. Can you hear me okay? I just wanted to check.
Yeah, we can hear you very clearly.
Very good. Thank you very much. And thank you for inviting me. And thank you, Dilip as well. I hope you and family are well. Namaskar, sir. So good to see you again. Very good to see you again. And very good to see you in a good health as well. In this pandemic crisis, hopefully your family, friends, everyone is okay. And I have said this again, and I'll say it again. I really like your new look. And I'm inspiring towards that as well. So with that, again, thank you for being with us.
Thanks.
On this important topic, sir.
Before you start firing questions to me, I just want to make two quick comments.
Please, sir.
First is Fireside Chat. You have used this name. I have to defend with very cool mind. I will use ice for your fiery questions. Number one. Number two, you have used my photograph, which was very old, that was taken, I think, at the time of my marriage. Now I am in a position when my son's marriage is. Now this is a new outlook. Anyhow, you start.
Thank you very much, sir. And it's very difficult to decide in which form you are looking at more dashing. So I'll think about it and I'll. But thank you, sir, again for being with us. The country is going through a crisis that we have never seen. We went through first wave, and we thought it's getting over slowly, but again it came back, and it came back with multiple magnitude. Friends, families, our countrymen, our colleagues, everyone is suffering, and it's seen around the world the impact the second wave has created. Thankfully, we are on the right track. Infection rate is going down, vaccination rate is going up. Hopefully things will get better, and our lives, not only in this country but around the world, will slowly come back to normalcy. And I really wish for everyone that they are safe, healthy, and their loved one and family members are safe and healthy as well. One thing we learned, sir, in this crisis, one is that the energy in people, the resilience in people to fight. I think that's something came out very well around the world, and more so in India we saw. In cities like Mumbai, which is heavily populated, but if you look at their resilience to fight and really to bounce back is unprecedented. I haven't seen that. And similarly, if I look at self-care, which is an important topic in today's world, and today is the topic of discussion as well, is heightened in this crisis. We have brought together all the tools from the cupboard, whether it's from Dadi So what I was saying, sir, we have brought all the tools from the cupboard, whether Dadi ka Nuksha to Ayurveda to Kadha to Haldi to everything, to Ayurveda to allopatha, everything to look after ourselves. I have seen, I don't know if you have seen the data, sir, number of bicycles sold in this country has gone multiple fold. The reason because the environment was less polluted, the roads were empty and people had a lot of time at home and they started cycling. So we have seen a lot of trends, whether it comes to food, whether it comes to preventive care, self-care, and to prescription care as well, if I look at it in three buckets. And we have seen that people's awareness and the level of self-care sense has gone tremendously up. For example, talking about drug development and approvals were a discussion of experts. But today, when I sit around a breakfast table, my parents who are quite elderly, and even Mace, they talk about the clinical trial and the phase and the approval of vaccines. So that's the level of awareness of drug development, regulatory framework has gone up in this system, and maybe positive side of crisis as well. We have seen even government has advocated for people to look at more technical areas like monitoring oxygen, which used to be sort of ICU function. And today, if you look at sale of oximeter on Amazon has gone rocket high, or monitoring their blood pressure, monitoring their temperature. Even government advice say take paracetamol if you have fever, if you have mild symptoms and COVID infection, stay home, look after yourself. All in all, sir, what we are seeing is that the self-care agenda has advanced in the society. The awareness that earlier speaker Sandeep and our colleague, European colleague, was talking about the awareness and education has gone multiple fold up. And therefore, role of self-care and OTC as such in that term has sort of magnified and signified as well. So that's what I see, sir, where I sit and my point of view. I would love to hear your view, sir, how you have seen in last 14, 15 months. What's your view? What do you see as a trend? What are the challenges and opportunities? I'm sure that challenges we have seen, whether it's with the oxygens or with the number of medicines that people started keeping at home and started going advanced sort of prescription care by themselves. So there have been many challenges, but I would love to hear your view, sir.
Thank you. Thank you very much. In fact, self-care, I think, is a double-edged sword. ये दुधारी तलवार है. And we always need to be very cautious while we are allowing the patient or the end user or the public at large, all the citizen, to go for self-care. Self-care is a right of the citizen. I have full right to stay healthy, and to stay healthy, I have the full right to use all the available tools with me, which keeps me fit and healthy. But these tools should be used with in a very cautious manner, in a very careful manner. I'm just coming directly to the example. When corona is a virus, and speaker just spoken, they were telling that virus is self-limiting and AMR इसमें नहीं आएगा, there will be no antibiotic resistance for that, and we should allow the antiviral drugs or the other small nuskhas which you are telling us to go for self-care of that. Then COVID-19, which till no pathy is in a position to claim any treatment, large and big false claims, I'm not going to comment on that. But as far as approvals are concerned, regulations are concerned, no pathy till date has any drug which can claim that this particular antiviral drug is an effective drug or pathy for the treatment of COVID-19 drugs. If it would have been there, then we would have come out of this pandemic and we should not have faced the second wave. What exactly we are doing is management of this COVID-19, not the treatment of COVID-19 first. And then self-care. Self-care is a big, large word. And as far as self-care is concerned, then yoga, pranayam, there is no pathy involved in that. That is my right. And as a citizen or as a patient, I have full right to go for yoga, pranayam, or all those things which you can say that my kitchen is giving me the management pathies for this particular virus using kadha, which for which Ayush has given the circular also. And one more thing I want to tell you that as far as self-care for COVID-19 is concerned or self-care for any disease is concerned, we have to be very cautious about the safety aspect of the drugs or the ingredients. Drugs here I am using for all Ayurvedic, allopathic, homeopathic, Unani, Siddha, etc., etc. Or even I am telling about the alternative pathies also. We have to be very cautious about those drugs, that these drugs which we are using for self-care are not causing any side effect. I want to make one statement here. Any drug which is having the effect is also having the side effect. And for any approval, if we are giving the indication that this can be used for the treatment of this indication, then there must be contraindication of that drug also. And now coming directly, leaving apart other things about the self-care, you have told the pulse oximeter. Pulse oximeter, although the oxygen concentrator discussion is going on in this time, that whether these are regulated drugs or not, whether courts are also examining this question, and Delhi High Court has examined this question also, whether oxygen concentrator is a drug, and they came to the conclusion that oxygen concentrator is a drug. They are right. They are right that oxygen concentrator is a medical device covered under the definition of a medical device given in this year itself and effective from 1st of April, I think. And after that, when we know that this is a medical device, now we have to examine whether this medical device is notified medical device as defined under section 3B4 of the Drug Act or not. Number one. Number two, whether this medical device is classified as a category A, B, C, or D based on the risk-based classifications. Then again, answer is there is only a draft available. And there is no as such notification as the for these two things, at least pulse oximeter and oxygen concentrator. Then we may come to the conclusion that these are drugs, these are medical devices and drugs, but not notified, number one. Number two, even after notification, Government of India has given a time for these to be regulated. Then these are drug, but not a regulated drug. We can say like that. And therefore, I can conclude the answer of this question that self-care. Yes, yeah. You just ask.
So what I'm saying, sir, we want to continue the discussion, but we have our guest here, so we wanted to introduce him and hear from him, sir. So sorry for interruption. Please accept my apology.
So on special request, and we have been joined by Dr. V.G. Somani, Drug Controller General of India. And we are very thankful for him to take out time and join us for a special address. Thank you so much, sir. And we are all very excited to hear your views, sir.
Thank you for joining, sir. Hope you are well and safe.
Thank you, Vicky. Thank you, Dr. Ahuja ji. Thank you, Mishra ji. Thank you, Swati. And thank you all the participants for giving this opportunity and a very timely agenda about the self-care. And we know that this corona has changed our life completely, because in the first wave we have seen the behavior of corona was different, and in the second wave we are seeing its behavior is different, probably because of the variants and also because of various other factors where we have seen that more people are affected. Oxygen was needed in a higher quantities. When oxygen was needed in higher quantities and when it was in a little bit of scarcity, people used as a standby drugs in a more quantities like steroids, and which has led to some other problems like mucormycosis. So all these things have, while we have been fighting and we have been seeing that this we get rid of this corona by various strategies of track and trace, test and treat, and also taking the strategies of containment and various other strategies to find out the new solutions, whether they are diagnostic solutions, whether they are therapeutic solutions, or whether they are preventive solutions or immunological like vaccines and all those things. And also, while all these things were in the scarcity, we have found a surge of certain things which are generally not expected, but because of certain things where we have seen drugs were also being black marketed at certain places. So we, along with the state drug controllers, because Dr. Ahuja is here, and various other players, Ministry of Health, Department of Pharmaceuticals, have been continuously monitoring all these situations, and there have been continuous guidelines in all these situations. Our primary role was, if you ask from the perspective of the CDSU, to see that how we can find out new therapeutics, new diagnostics, and new vaccines. And in this, fortunately, our scientists started early, and we have been able to see that two indigenously developed and well-tested vaccines we could approve, and simultaneously approve means give the restricted emergency use, and also one imported one, that is Sputnik V. After due clinical trial, we could give the approval to that. Simultaneously, various other agents like the cocktail of antibodies from the Roche, from the Eli Lilly, the products like itolizumab, favipiravir, baricitinib, these have been also given the emergency use approval based on various national and international data and various trials which are conducted in our countries, at times without trial also based on the international data. So irrespective of all these things, there is a hanging sword that we still don't know the how the because the virus which is spreading all across the world is changing more rapidly than we are able to find the solutions. Though the prediction says that there will be third wave, it will be of a milder nature, it may affect the different age groups, because we have seen last time the age group which was affected was more elderly, this time elderly plus the younger population was also affected. And in the third wave, it is projected that we can have more problems with the children. So accordingly, our country scientists have started the trials to find out the solutions for the children, and also not to leave aside the pregnant women also. So there has been a continuous efforts to find out the solutions. But when we find out the solutions, then becomes the question of the availability. Whether these solutions, these drugs, these diagnostics, are they available in the ample quantities? For that, indigenous development, which we call as a Atmanirbhar Bharat, becomes very important. Developing those diagnostic agents, developing those APIs, developing those drugs and vaccines in India. For that also, our Honorable Prime Minister and various departments like Department of Pharma, Department of Biotechnology, ICMR has taken various steps to fund various schemes whereby these problems can be attended immediately also. And also I should not forget the contribution of Ministry of External Affairs, who is finding whatever, there are problems starting from starting material, excipients, the fermenters, filter bags, disposables, the simple filters like of Pals and Sartorius. These are also becoming the bottlenecks for making the availability in the huge quantities of whether it is a vaccine, whether it is a liposomal amphotericin B, whether it is any kind of other things, because many of these things are used. If you take the example of the excipient which are used in liposomal amphotericin B, the same excipient are also used in making of the mRNA vaccines. All over the country, all over the world, most of the time, the availability of the media for producing the vaccine is becoming also a bottleneck. Also, while we were allowing various manufacturing units to make the remdesivir, the availability of beta-cyclorexine was also becoming a problem. So developing this indigenously and also sourcing it from outside to find out the solution for the short term also and for the long term also. All the departments have been working day and night. And also, while there are certain frivolous elements of black marketing and all those things, they have been also tackled with a very heavy hand so that public can gain the confidence. Self-care has gained more importance because whatever we are doing, we are finding we are falling short of the solutions. Wearing the mask, using the sanitization, keeping the distance, not unnecessarily gathering, utilizing the digital platform. This has to become a new normal and has to be adopted in our daily life. Further, we are also progressing. Yesterday only, we have approved a self-test kit for the corona. So that is, in that direction, we will have to move. Point of care diagnostic, point of care solutions will also be required because large number of populations, sometimes even for their medication, hospitalization, vaccination, or diagnosis, they may not be in a position, whether they are immunocompromised or elderly people, they may not be in position to reach to the places where these things are provided. So self-care, self-test, point of care solutions also become a most important thing, and we are encouraging those and we should encourage those. This particular program organized by FICCI and wherein the galaxy of the people like Dr. Y.K. Gupta, Ahujaji and all other I cannot name because all of them are there to guide all of us is a great initiative. And despite all these things, FICCI could find the time to organize this such program is a great thing. I will not take much of your time. There are various initiatives which are being taken by Honorable Prime Minister at a very large scale so that this problem will be solved in totality. Thank you very much.
Thank you, sir. Thank you very much for your remarks. And I'm very thankful that you found the time to join us. We are very grateful. I know, yeah, I keep hearing that you are in office until 1 o'clock, 2 o'clock, and the country is on war footage. So in this your busy schedule, you found time for this address. So I'm very grateful. And I agree, sir. What we have seen in last 12 to 15 months is a surge of self-care, as you rightly said, in testing and utilizing all the tools, whether it's the Ayurveda tool, naturopathy tool, Dadi ke nukse, everything. And really the country has come together to fight this war. And we are very grateful that we have leaders like you. And as a country, we are sort of pharmacy of the world, and that is blessing for us. So thank you again for your support, and thank you for joining us, sir.
Thank you, sir, for joining us today. And thank you, Ahujaji, for and apologies for the disturbance in between. Over to you, Arun, for the session.
Thank you very much. Thank you, Ahujaji. So,
Thank you.
sir,
Can
where
I
we were?
sir?
Thank you. Sir, feel free to stay with us if you like in the conversation, but I understand your busyness, so it would also be okay if you decide to leave us, sir.
I will be joining sometime afterwards, please. Thank you,
Thank
sir.
you, sir. Most welcome, sir. Thank you. I just wanted to say good afternoon, Gupta ji. Hope you are well. So nice to see you. And we will be coming back, bringing you in the further discussion as well. At the moment, sir, what we are doing is a fireside chat with the cool responses from Ahuja ji. That's where we are. Sir, moving on in terms of trend, as you talked about, and very rightly, sir, if I look at it's a double-edged sword that we have in terms of self-care, and we really have to have caution in terms of how do we use the tool. This could be really benefit us, but this could really harm us as well. And we have seen that in last 15 months, we have seen both sides of the coin at the same time as well. I think, sir, thinking and then therefore question, as Sumani ji was saying as well, how do we really shape it so that we can utilize the best side of it and really protect ourselves from the harm side of it? And one way to look at it, sir, is having one, of course, to start with having proper regulatory framework and enforcement of it. That's one part of it. But then second, as our earlier speaker said, is around awareness, knowledge, and understanding. We have seen tremendous progress in society in terms of awareness, knowledge, and understanding when it comes to some of the medical, medicine, or drug related or therapy related tools. But somewhere we have seen they have gone overboard as well. So I think these three elements with the policy related perhaps would help us to embark on that journey, because we will start somewhere. That will not be the final destination. That will be the starting point. So, sir, how do you see, especially coming back to now OTC regulatory policy shaping? We have done tremendous amount of work in last 5-6 years. And of course, for obvious reasons, in last 15-16 months, it has slowed down because our attention has to divert as a country to really fight this war. But how do you see, sir, progressing this agenda further in the larger bucket, as you rightly said, with caution?
Taking best out of this pandemic. हमें आपदा में अवसर never means that we have to misuse what the pandemic is giving, the lectures to us, teachings to us, lessons to us, but we have to take best out of it also. What best out of it? As far as OTC is concerned, I'm again saying it's a double-edged sword and we have to be very cautious about it. And I want to share one information for the benefit of all the participants, that OTC regulatory pathway has been laid down. Committee has submitted its recommendation to the DCC, and this was discussed in DCC also, Drug Consultative Committee, and as far as the regulatory pathway is concerned, DCC has almost accepted those regulatory pathway. Only discussion left was that the list of drugs to be given clearance as OTC products, that has been taken on hold. Only few products which we considered as risk benefit ratio, when we take both under consideration, we thought that it is having benefit weighing much more than the risk. Those have been approved by making these available in the Schedule K exemptions, not in the OTC regulations. Now OTC regulations as a principal regulatory pathway has been almost accepted, and this will come up in the next DCC, as I think. First. Second, OTC, as far as you have told that we have to consider number of things, then and the earlier speaker was also speaking on that point, that in Europe we are adopting such policy, we are adopting such policy. I just want to make one comment on that. As a country, we cannot cut, copy, paste any policy from any other country. We can take good leads from those regulations adopted in other countries, but we need to customize these things as per our country needs, because health literacy, we are saying that this pandemic has increased the health literacy in my country, but I have some other idea also. We are just reading, our country citizens are reading in WhatsApp University, and we all know what exactly is coming in the WhatsApp University becomes, if we consider that these WhatsApp messages are useful and making the countrymen knowledgeable as far as healthcare is concerned, then we are not correct. We are a bit wrong on that. One small example I want to share with you. Using favipiravir at home by home isolated patients, that too when this favipiravir is not approved for this particular virus, antiviral drug, and everybody is taking in the home isolation without getting any prescription from any registered medical practitioner as defined under Rule 2EE of the drug rules. And we consider, we say that now everybody is literate enough that they know the dose of the favipiravir, and many so-called, I should not name, but social workers, they were also distributing this favipiravir as a matter of helping the home isolated COVID-19 patients. Then I think we have to think over again, and we have to segregate what is to be covered in OTC and what is not to be covered in OTC. As a broader line, I can say any new drug should never be OTC, number one. Any drug which is in Schedule H should never be in OTC. Number three, any antibiotic which can cause the resistance should never be in OTC. Any drug containing narcotic or psychotropic substances should never be in OTC. अब आप कहेंगे you have removed everything, what you have included, and all other leftover can be included with caution, and every applicant, you people will become applicant, your members of FICCI will become applicant for different formulations to be decided and judged by the Honorable DCGI as OTC product, or the committee which the government will form. Final approval is to be given by DCGI that this drug is now OTC drug, OTC1 or OTC2. That I answer to that also. I will address to that also. But you have to submit the safety data, and you have to give the mechanism of empowering the last man. In my country, I use the word Antyodaya. I use this word अंत्योदय, अंतिम व्यक्ति का उदय जिसको हम मानते हैं, यानी कि मेरे लास्ट मैन who is totally illiterate, living in a village, having no internet facility with him, is to be given the knowledge of usage, diagnosis of the symptoms, usage of the drug required to treat that symptom, everything. When we become sure enough, now the last man in my country in Antyodaya Yojana is able to do that, then only we can think that now OTC is seeing the light of the day. We can go for
Absolutely.
OTC regime.
And,
Yes.
and absolutely, sir. Absolutely, sir. And I think that's what the healthcare and healthcare solutions are. As you rightly said to start with, sir, it's a double-edged sword. It's a matter of health. And therefore, we have to be very careful and cautious. And we have to take in the last man standing on the last mile. We cannot leave anyone behind. It is everyone together in this, and that's our collective job again to bring awareness, knowledge, and understanding of the different tools that we have so that we use the better side of the sword and not the wrong side of the sword, sir. So that has been very helpful. Sir, thank you for your views on the process and status where it is. Any thoughts around tentative timelines that you are looking at in terms of having the draft guideline for consultation or the list or anything?
It would have been cleared if the second wave of the pandemic we have not faced. It would have been cleared. But I don't want to give any timeline, but just want to say one line that Modi hai to mumkin hai, or it will be definitely we will see the OTC regime in our country, which will not only empower the registered pharmacist, it will empower the common man to treat his own symptomatic small ailments. He is empowered to diagnose his own small ailments, and it will also cut the cost of treatment, which is also a area of concern in my country, as we are seeing and getting the complaints of heavy bills. Arre, the patient is saved from the disease of corona or COVID-19, but he's dying because of the over billing by the hospitals.
The financial
Everything,
burdens.
when we are going for the self-care, it will cut the cost of treatment also, because and
No,
everything.
absolutely, sir. I think
We
the
have to.
biggest one of the biggest change will happen, sir, is this whole infodemic, if I could say, from WhatsApp University to credible source of information, so that people are much more again aware, knowledgeable, and understand what they are doing. So I think that will help in that direction. But sir, the other thing which is theme of this discussion is as well is Atmanirbhar Bharat. But I think this OTC and self-care muhim is also making Atmanirbhar Bharatiya. So Atmanirbhar Bharat will only happen when we have Atmanirbhar Bharati as well. We have our fellow citizens have done a lot of experiments, but I think this will give them a credible information and credible source of information to make the right decision. So that will be very helpful. One request, and then I want to move on to the next layer of discussion, sir. आपने
Yeah.
एक नई कविता सुना दें, बहुत दिन हो गए सुने.
अरे
दो
ऐसा
लाइन सर, दो
definitely.
लाइन बस.
Okay. Just take 2 minutes
Yes, sir.
to come out with that, and then I will definitely आपकी जो है आज की इच्छा वो पूरी मैं जरूर कर दूंगा, और कोई ना कोई 2 लाइनें मैं जरूर सुना दूंगा, बट उसके लिए मुझे 2 मिनट का समय जरूर चाहिए होगा, और उस समय को लेने के साथ साथ मैं आई वांटेड टू जस्ट से वन थिंग. When we are going to make Atmanirbhar Bharatiya, then we have to see one more thing, that excess use of kadha, it may go for piles. To make Atmanirbhar Bharatiya, we have to empower them with the knowledge also. जब हम उनको knowledge दे देंगे तभी हम उनको कह सकेंगे कि these are now they became Atmanirbhar Bharatiya. Otherwise, we cannot say कि ये ऐसा होने वाला है। तो एक
बिल्कुल
तो
बिल्कुल सर। और
लाइफ
सर
एक
जरा काढ़ा के बारे में थोड़ा और बताइएगा, क्योंकि मेरी जो श्रीमती है ना थोड़ा ज्यादा दबाव डालती हैं काढ़ा के ऊपर।
आपको काढ़ा पिलाने के लिए
अब क्या करें।
अच्छा है, लेकिन आप काढ़ा उतना ज्यादा मत लिया कीजिए जितना आपको श्रीमती जी देती हैं। हाँ, तो एक आध टाइम का तो ठीक है, बट ये अगर सुबह दोपहर शाम सिर्फ काढ़ा ही पिला रहे हैं तो प्लीज बी केयरफुल। चलिए, अब
हाँ
एक दो
सर,
आपने कहा कविता तो सुना देते हैं। तो
प्लीज सर।
वो भी मैं इसीलिए, क्योंकि टॉपिक भी सेल्फ केयर है और कोरोना का है, तो दो तीन लाइनें। नमस्ते अभिवादन करो सबको यही सुहाए, हाथ मिलाकर बांटते कोरोना हो जाए, गले मिलाकर बांट रहे, गला मिलते हैं हम लोग, गले मिलाकर बांट रहे वायरस फैलाए, वैदिक अभिवादन करो नमस्ते यह सिखलाए, दिल से होते दूर वह रहते जितने पास, दूर दूर पूरा रहे। आज आप पता नहीं बॉम्बे बैठे हैं, स्वाति जी पता नहीं कहाँ हैं, मैं यहाँ पंचकुला में हूँ, डॉक्टर सोमानी दिल्ली से थे। तो फिजिकल डिस्टेंस इज टू मच, बट वी आर वेरी क्लोज टू दी हार्ट। तो इसीलिए कहा दिल से होते दूर वह रहते जितने पास। घर में रहते हैं तो घरवाली तो साथ ही रहती है, लेकिन कई बार झगड़ा रहता है तो दिल से बहुत दूर होते हैं। तो दिल से होते दूर वह रहते जितने पास, दूर दूर पूरा रहे रहकर दिल के पास, हाथ मिलाकर दे रहे झटका भरपूर, नमस्ते अभिवादन करो रहकर थोड़ा दूर। मेरे ख्याल में इतना ही काफी है। एक आध और सुना देते हैं, चलिए। हाथ साबुन से धोकर करना कोई काम, वरना कोरोना होगा कर देगा बदनाम, अस्पताल मंदिर बने कर्मी हुए भगवान, इन पर पत्थर फेंकते वह सारे शैतान। आई थिंक इट्स सफिशिएंट। थैंक यू
बहुत
वेरी
बहुत
मच।
धन्यवाद सर, बहुत बहुत धन्यवाद। आपने कहा, मैं पूरे डिस्कशन को थोड़ा समराइज करने की चेष्टा करता हूँ। बहुत अच्छा डिस्कशन रहा सर। व्हाट वी आर कमिंग आउट ऑफ दिस, एंड दिस डिस्कशन विल कंटिन्यू एज वी हैव बीन डिस्कसिंग फॉर लॉन्ग, एंड वी विल कंटिन्यू बिकॉज इट्स अ इवोल्यूशन सर। I think one thing is very clear, sir, as you rightly said, the factor of self-awareness has gone up in the country, in our population. How do we look after ourselves, our people, our family has gone up. There's a heightened sense of self-care and utilize all the tools that we have, whether it's our medicine of kitchen or nuksa of our dadi or OTC medicines that we have, or Ayurvedic medicines that you have, or yoga that we have, all tools that we are using and trying to make ourselves more into preventive care to prevent not to happening. And if it happens, then how do we manage ourselves? We have learned how to use oximeter. We have learned how to read that. We have learned how to look after temperature. We have learned when to take paracetamol or not. We have learned what the drug development is, what the clinical trials are, and what are the regulatory status of different vaccines. So I think overall awareness has gone up, which is a really good thing in the society. We are moving towards awareness, knowledge, and understanding in self-care space. As you rightly says, it's a double-edged sword. We need to make sure that we use the right side of it and not the wrong side of it. And one important tool in that is having a proper, robust regulatory framework, which enables also to, as Somani ji said, is a point of care as well, whether it's a medicine, testing, diagnostics, point of care, which enables the digital health, which enables, but at the same time prevents this infodemic of WhatsApp University at the same time, so that we get a credible source of information. I'm happy to see that it has reached to the DCC state, and soon we will be able to see the draft, and we will be eagerly waiting for that as well. Meanwhile, if you, sir, believe that there are other areas where industry associations and academia can come together and really provide more information and support this journey for our country and for our fellow citizens, we will be more than happy to. So please do let us know on that one. With last one, I would like to close, and then I would like to hear your closing remarks as well. Apada mein avsar, and this is also an avsar for us to change the direction and to really make Atmanirbhar Bharat, but also more so make Atmanirbhar Bharati. With that, I would love to hear your closing remarks, and then I hand it over to our facilitator, Swati, for closing this session. But before that, I really want to thank you again for being with us. I want to really thank entire FICCI committee for giving me this opportunity And more so, I want to really thank the young budding regulatory leaders like Martina for bringing this together.
Just last comment. I always see, I don't know my mathematics is correct or wrong. I always say 1 plus 1 is 11 and 1 plus 1 plus 1 is 111. I never do 1 plus 1 2. Or people are now doing 1 plus 1 1, but they are doing minus 1 and they are making it 0. My small comment about what I am saying is all the pathies should come together to fight against this invisible and continuously changing its face or changing its रूप बदल रहा है ना बहरूपिया virus. So we have to fight against that virus which is mutating again and changing its nature again and again and coming back and attacking again and again. Then all the pathies available in my country, at least allopathic and ayurvedic, they should not fight with each other and make 1 minus 1 equal to 0, but they should come together. And my government has done a tremendous job for that. Our government has taken a decision that Ayurvedic drug, Kadha, and immunity boosters, Giloy Ghanvati, etc., even one homeopathic also, arsenic album 30 is a drug. Along with those azithromycin or doxycycline or ivermectin or vitamin C or zinc to all the home isolated patients under the telemedicine supervisions of doctors. That is what exactly we are doing. We are trying to collect all these pathies. We have to put all the horses together in one direction and then pull the cart. If we are putting those horses in different direction, then we are going to stay where we are. We have to fight with this coronavirus. We have to come victorious against this fight, against the coronavirus in this fight. And thank you very much for giving me the opportunity. And we
Thank
will,
you, sir.
I think, we'll definitely see the OTC regulation coming in the regulatory mechanism. Thank you.
Thank you, sir. Thank you for being with us.
Thank you, sir, so much. And I'm sure the OTC guidelines will definitely help increase accessibility of health, even in the rural or poorest area, and foster self-care in all parts of country. And I'm very sure that all the pathies in India will come together to fight against coronavirus. So thank you so much, sir. With this, we now move to our next part of the conference, which is the panel discussion on self-care, the foundation for India being self-reliant, Atmanirbhar. The moderator of this session would be Ms. Susan Joshi, Managing Director, Havas Health and Youth, Southeast Asia and any region. She has more than 35 years of experience in healthcare marketing and communications. Her organization has a strong, long-standing partnership with Nicholas Hall and Company, the global expert in this domain. With a deep passion for consumer healthcare, she has conducted and also been a speaker at many national and global consumer healthcare conferences till date. Hi, Susan, and I request you to welcome all the panelists and start the panel discussion.
Thank you so much, Swati. First of all, trust me, for the last 2.5 hours, the kind of discussions that we had and the exchange of information between the regulators and, of course, people from the industry, it was very heartening to see that a lot of hard work in the last so many years of seeing a OTC policy come in is going to be a probability soon. And that's a very, very heartening statement. And that's why I would love to thank Mr. Ahuja also for giving us this very warm news and take this ahead. So also want to thank Bayer and Fiki for inviting me to make this, to kind of conduct this panel discussion. Self-care, of course, I mean, I think it's a wonderful, it's a wonderful time when healthcare has taken such a big center stage, right? We have always talked about Atmanirbhar, but we always talked of it from manufacturing, from our IT capability. But today, it's always going to be remembered more and more that how are our consumers taking care of themselves? And everyone is pivoting to the same thought that can I manage myself better? Can I fight this coronavirus better? Can I be far more immune to this kind of a disease? I mean, literally people who think they have got a COVID and those who have not got COVID, they've become two polarized teams in our country. And each one tries to say, Acha, you didn't do something well, or maybe your immunity is low. That's why you got it. So, it's almost become a talk day to day. And I'm sure everyone wants to be in control of their self. I'm really happy to also say that, very about an hour ago when Girate presented the whole European self-care study on the economic value, we had done, in fact, very recently, we did a similar study, which is the first of its kind in India. And we also had very similar findings that the amount of money that is being kind of saved, when you look at it from an economic value, it is humongous when you start seeing that you have empowered consumers for self-care. There is a similar cost which goes to the doctors, to the medicines, to the kind of loss of productivity which Sandeep also spoke about. And therefore, the value of self-care, how important it is becoming even more and more. Very soon, we will be presenting that data, and I'm sure it will be an eye-propping one when you see the kind of savings we can get if we start making consumers knowledgeable and aware of themselves. So this is really an interesting hot topic. I'm sure it'll take a lot of depth and value to understand. And also what I liked when Sandeep spoke about a very interesting triangle, at the bottom of it is self-care. And as you see costs going up, the primary care and the secondary care and the tertiary care keeps adding to the cost. And therefore, it makes so much economic value for all of us to drive the agenda of self-care in this country. So this is the right time. And we have got one of the most august panel of dignitaries on this panel. I'm very privileged to welcome them. Welcome to each one of you. I'll do the honors of introducing each one of them. I can see, Swati, I can see maybe 4 of them, but I didn't see Miss Dr. Manjari. I think I could see her for a short while, so I was just wondering, I hope I have all the panelists on the screen. But just to start with, we already have the introductions done. Sandeep is one of the panelists. He's already been introduced. So I'm not going to repeat it, but it's a privilege to have someone like Sandeep who comes with a very, very strong FMCG background. And I've worked with Sandeep, and I must tell you, it is heartening to see the kind of vision he has. I mean, launching an entire organization on the backdrop of saying that we want to make a larger a purpose on self-care itself is a meaningful one. So welcome aboard, Sandeep, on this panel. It's our privilege. I would next like to go to Mr. Atul Kumar Nasa. Very welcome, sir, because you would be now getting another regulator's perspective. We already had, Dr. Ahuja's perspective, Dr. Somani's perspective. Mr. Atul Kumar Nasa is the head of Office Controlling and Licensing Authority and Deputy Drug Controller with the Drug Control Department, Government of NCT, Delhi. He's a member of various committees constituted by the Government of India, Government of Delhi and Pharmacy Council for framing and designing different policies. Mr. Nasa has been nominated as a member of the Pharmacy Council of India, and he has worked extensively on the e-pharmacy guidelines. And he has also worked along with Mr. Ahuja on the OTC policy. We are going to hear some interesting insights from him also. To get a view on how the medical community thinks of self-care, we have Professor Y.K. Gupta. We all know Professor Y.K. Gupta. I think at some point of time, we have all heard about him. Very warm welcome to you, Professor Y.K. Gupta. He's currently the Principal Advisor of the Translation Health Service and Technology Institute, Department of Biotechnology, and he's the Principal Advisor to the India Strategy Development, JARDP, DNDI. He's the President of AIIMS, Bhopal, President of AIIMS, Jammu. Earlier, he was the Dean and Head of Pharmacology, AIIMS, Delhi. Dr. Gupta has some impeccable credentials and has been on the board of many institutes and has more than 380 publications to his credit. We are extremely fortunate to have you on our panel today. We really look forward to your insights, Dr. Gupta. The fourth panelist is Dr. Awula. How is self-care different from a nutritionist point of view? So we have, like I already said, we have a very different genre of all these dignitaries on our panel. Dr. Avula is the Director, Great Scientist, and Head Division of Public Health Nutrition, ICMR, National Institute of Nutrition, Hyderabad. He has an academic background in medicine and public health with hands-on professional experience in public health nutrition at the National Institute of Nutrition, ICMR, Hyderabad, and he has been involved in many trainings and capacity building programs. He has done some extensive studies, epidemiological studies, operational research, randomized clinical trials, and has some more than 125 papers in national and international journals. So once again, hearty welcome to you, Dr. Avula. Our next panelist is from my domain. I'm a pharmacist by profession, so I'm very happy to welcome Dr. Manjri Sandeep Garat. She is the principal at KM Kundnani Pharmacy Polytechnic, Mumbai. But more importantly, she's also the vice president and chairman of the Community Pharmacy Division of the Indian Pharmaceutical Association since 2012. Manjri writes a lot in many newspapers. She's actually been very awash of all her ideas on how pharmacists can help. And she's the first woman vice president of the Indian Pharmacy Association in its 75 plus years. Now that's a brilliant credential to have someone like Manjri on our panel. She has many accolades to her credit. And again, with this limited period, I'm actually constrained to go through all of it. But what is interesting is with all her full-time job in academics, she has been working consistently in driving the pharmacy community programs and consumer education. And she's passionate about self-care. I have interacted again with Manjri a lot. And very happy to have you, Manjri, on this board, on this panel. So hearty welcome to you, Manjri. So without much time, I know we are all, we have a very strong panel. I want each one of them to be given a chance to speak. So I'm going to hand over to start the conversation with Sandeep. So Sandeep, for you, you have already spoken earlier also, but I'm sure you will have a lot of views on how you see self-care for a self-reliant India when we have this topic. As a consumer healthcare company, what role do you see yourself in this movement?
Okay, I think I'm audible now. Susan can hear me, right?
We can hear you. We can hear you.
Okay, yeah, it's the first check to do for the discussions, all conversations. So I think to become, so the way we look at it, I think in order to become a self-reliant nation, one of the things that we need to do is to focus on enhancing the credentials of our human capital, because the human capital is the most important aspect of the national productivity quotient. And if you want to become a self-reliant nation, you have to enhance the national productivity per se. So healthcare industry, will have a very important role to play in improving the healthcare credentials of this human capital. And that's where we as a consumer health company come into the picture as well. We are obviously just 1 month old, though our brands are more than 50 years old, but as a company, we are just about, we just completed 1 month today, actually. I think self-care, the other thing that we need to keep in mind is that self-care can and does influence behavior in very important ways for consumers throughout his or her life stages. Yeah. So by acquiring relevant knowledge, skills, competencies, people can be better equipped to engage in self-care activities and positively influence their own health. We at Bayer Consumer Health, we believe that we can empower people, empower all Indians to transform their own health and that of their families and communities as well. When people become proactive about their own health, it results in a much better management of obviously their overall health, and eventually results in economic benefits both at an individual and at a national level. So I think some of the speakers before me have mentioned this whole saga of WhatsApp University, and in fact, I also mentioned it in the presentation that I had. So the challenge is when you are in dark about anything, you literally try and clutch at the straws, whatever it is that you can get. If you're going around in darkness, the faintest glimmer of light you see, you move in that direction, and sometimes that's what happens, and that's what makes people a little bit fearful of self-care, and that's also what happens when people, which makes people do the wrong things when it comes to self-care. So it is critical for us to, and that's where we can play a very big role, to empower the people with the right kind of information. So this whole gap between awareness, information and understanding, awareness, knowledge and understanding is where we can play a very, very important role and help people, take very well informed decisions about self-care of their own selves and their own families as well. And I think, in general, we call India an incredible country. India cannot become incredible and cannot remain incredible unless each and every Indian becomes incredible. So like the speaker before me said, Atmanirbhar Bharatiya is required for Atmanirbhar Bharat. And that's why every single Indian must have the tools to be able to fulfill his or her dreams. And only then can we become a completely self-reliant nation. And I think that's where consumer health comes to the picture. And that's where we, as a consumer health company, come into the picture.
Brilliant. I think, Sandeep, just to quickly ask you, because you made a very pertinent point that, how do we make each and every Indian Atmanirbhar? And in that spirit, what challenges do you see? Because, it's just a rider to the question that we have, because when we know what challenges are there, it also tells us what we can do about this, because what you have set aside as your task and what you're talking about is absolutely the right one. But what kind of challenges do we see when we want to do this?
So you're right. Unless we know the challenges, how are we going to address it? The way we see it, we see at least four big challenges that we can elaborate, that I can elaborate on, and we can quantify. I think the first one I just spoke about, it is the right level of health literacy. I think whether it is, we heard from Jurate, whether it is the European Union, or whether it is India, or whether it is any other developing or developed countries, unless you have the right level of literacy, unless you have the right level of awareness, right level of knowledge, leading to a right level of understanding, you will never be able to get responsible self-care. And I think Dr. Ahuja was talking about self-care, about people taking all kinds of medication without knowing too much about it. I think what we are talking about is responsible self-care. So maybe we should qualify the self-care that we are talking about as responsible self-care. And responsible self-care only comes with the right level of health literacy. So that's going to be the first big challenge that we have to sort out, which is to get the consumers to change their habits and behaviors based on the right level of information and knowledge. So in business terms, the work that is required to be done here is called market development, where you are essentially getting the consumers to adopt new practices on the basis of the right kind of information that you are giving to them. So this is often the most difficult aspect in any marketer's work, and sometimes it can take years. I can give you an example. When I used to work on Lifebuoy on the hand hygiene program, and again something that we were working with the government of India on getting people to wash hands with soap. Now that again was one of the challenges where the right level of health literacy was very important, and I think that program is still continuing. It's been a very successful program, but it's still continuing. Right. So that's the first challenge that I see here about the right level. The second challenge is how do we democratize these self-care tools, this self-care information to everyone in India? So how do we provide access even to the underserved communities in the remotest corner of India with the self-care tools? So I feel that technology can play a very important role here. Accessibility to products can play a very important role over here. So that's the second challenge, which is providing access, democratization of self-care tools for everyone. The third one is related to the second one, which is a very clear and uniform interpretation of OTC rules and regulations by everyone. And I think I'm not going to dwell on it much because I think we've already got the good news that the draft rules and regulations are coming very soon. So that will definitely help us enhance accessibility to the underserved. And I think the last challenge, which is more an opportunity and not so much of a challenge, is how do we partner the chemists? How do we partner the pharmacists? I think the pharmacy programs in this country are still at a very minimal level or at a very primitive level. We need to make them ambassadors of self-care movement. In most part of the countries, as we already know, it's your neighborhood pharmacy guy who often acts as your self-care evangelist. He is your knowledge source for minor ailments from headache, to even preventive healthcare as such. So I think those would be the four challenges that I would see in terms of taking this forward.
Fabulous. I think, Sandeep, you've almost said exactly what I had in mind, that, certain areas which even what Jurati talked about, the whole pharmacy part of it. And we have, Manjari here. I'll come to Manjari a little later, but I want to talk about another very important pillar in the whole self-care movement is our doctors, because we do have a very, limited doctor ratio. We are one of the ones who don't have such high level of number of doctors. And there is a huge burden on the healthcare system. And that's where I want to ask Dr. YK Gupta, from his, lot of practice and knowledge and being in AIMS, how does that, when we start seeing this aspect of healthcare burden, how do you see this self-care helping reduce the same? And what are your views as a doctor, representing the medical community, Dr. Gupta? What are your views on this? So over to you, Dr. Gupta.
Thank you very much, Sushan, for inviting me to this very, very interesting discussion. And I was listening to the poetry also before this, and also wonderful talk just before this. And I will start with what he said. Self-care, self-medication, I will say self-medication is a bad word. Remember, it is a bad word. Whether it is by doctor, by pharmacist, by patient, is a prohibitive thing. However, I am talking of in Indian context. However, if you can put this as a responsible self-medication, this is good. Then this has all the positive thing, reducing the burden on the doctors, healthcare system, financial advantage, or difficulty in accessibility of doctor and all those things. This issue has been debated for last 20 years. The first meeting which I addressed on responsible self-medication was almost 19 years back.
Wow.
Really. This has still in baking. Why? Because you have, or the government or the society has not paid attention to cooking medium, to cooking utensil, and straightway we want to serve the food, which do not know who makes it and who eats it. So first, you create an atmosphere, you educate the public, make them responsible. They understand that is what is safe. They understand what is the safe dose, what is the safe drug, and what is OTC. OTC has this word OTC, over the counter drug, means outside any drug which can be sold at the shop and by the pharmacist without any prescription. In India, there is nothing like OTC. There is no legal definition of OTC. Any drug which cannot be sold, which does not require prescription, is an so-called OTC. Now, we have to first define it. And I was part of a couple of committees earlier. वो सब कमेटीज बनती हैं, वो डेड हो जाती हैं, डेड होती रहेंगी कंपनी, क्योंकि उसका कोई बेसिस नहीं है. We don't create infrastructure for creating awareness in the public, and the public in India. Now just see in India where itolizumab, where the corticosteroids, where any antibiotics, whether you call as a schedule H1 antibiotic or anything, are available either free of consultation or with minor consultation or with Jaan Pehchan chemist or with Jugadu prescription. It is available, and you have seen the responses, starting for as serious as mucormycosis because of the high dose of corticosteroids, self-medication. There are several cases of high dose self-medication and getting itolizumab and getting mucormycosis, and also treating them with the fungal drug, antifungal, because they don't want to go to the market and get involved into the either bhag rahe hain, either bhag rahe hain. Now, half of the COVID patients are doing what is called as self-care, self-medication. Everybody is started taking, बाजार में से गायब हो गई हाइड्रोक्सीक्लोरोक्विन, किसी डॉक्टर ने नहीं प्रिस्क्राइब करी, पैरासिटामोल गायब हो गई. Now, azithromycin tablet was sold for 600 rupees, 10 tablets. So 1600 rupees one tablet in Muzaffarnagar. This is newspaper clipping. Who is buying this? Self-medication people. Now, disaster, antimicrobial resistance, disaster, and analgesics taking every day, kidney problem, disaster taking paracetamol, liver problem, disaster taking so many drugs, you have a gastritis, disaster taking so much of antacids, you have a bone problem, osteoporosis, disaster taking because नींद नहीं आ रहा है, then you know what you to take it, you take alcohol, alcohol से काम नहीं चला तो उसमें एक diazepam मिलाओ, एक पैक alcohol लो, एक diazepam tablet मिलाओ, 3 पैक का मजा ले लो, and ultimately what you are getting psychosis, you are getting tension, you are getting anxiety, and then this vicious cycle. Dangerous friend, family to family and friend to friend. What they are doing? Promoting what is called as a self-care. No way this is good. Convert this into responsible self-care. Responsible, what my predecessor has said. Educate them first. अरे भाई पहले उनको ये तो बताओ कि दवाई के अंदर ये जो पर्चा होता है जिसमें इंस्ट्रक्शन लिखे होते हैं, जिसमें यूज करने का मेथड लिखा होता है, वो तो पढ़ना सीख लें पहले. अरे वो पढ़ भी लेगा तो जो आप लोग जो दवाई बना रहे हो वो ऐसा करेगा कि माइक्रोस्कोप लेके आएगा तब जाके पढ़ाई में आएगा. उसने पढ़ना भी सीख लिया, एनालाइज भी करने लगे, पढ़ नहीं पाएगा. तो पहले आप रिस्पॉन्सिबिलिटी दिखाओ. मींस मैन्युफैक्चरर शुड मेक रिस्पॉन्सिबिलिटी, रेगुलेटर शुड मेक become responsible, punish those who make such type of prescription, such type of leaflet which cannot be read by the common man. And we are talking of a self-care. Now, I think so. Definitely, this is a movement. This is a very noble movement which will reduce the economic burden to those who are paying out of pocket to doctor, out of pocket for medicine. एक आदमी डॉक्टर के पास इसलिए नहीं जा पा रहा क्योंकि उसको 500 रुपए फीस देनी पड़ती है, 1000 रुपए फीस देनी पड़ती है. अरे उसके 1000 रुपए बच जाएंगे तो 3 दिन का घर में खाना चलाएगा वो. लेकिन बचने के चक्कर में उसको 3 दिन की जगह 30 दिन अस्पताल में एडमिट होना पड़ गया ड्रग रिएक्शन की वजह से, तो डेंजर है. So both things, walking on a tight rope, that means you create first, create atmosphere. I would say those who are propagating self-medication, self-care, responsible self-medication, I am with them to fight till last. But they should first set their whole home, their house in order, or at least simultaneously work on both. Show that yes, you are socially conscious, you are creating awareness, you are creating education, and you are also creating a mechanism by which people who are doing this self-medication are harmed, least harmed, and if harmed, there is a mechanism to address that. ये एक अगर आप क्यों नहीं आप 1000 करोड़ रुपए का कॉर्पस इकट्ठा करते हैं and then make this corpus available to such patients who suffer from adverse drug reaction.
Absolutely.
And we are there. I am the scientific coordinator of National Pharmaco Vigilance Program. We have created a software where a person can report adverse drug reaction himself, whether it is because of self-medication or it is because of wrong medication or because of prescribed medication. But this requires educating them, and this requires concerted effort. I would go to the other area where self-medication could be important. Corona mein everybody has an oximeter. उसमें से 20% लोगों को तो पता नहीं कि किस उंगली में और कैसे लगाना है, और वो बेचारे घबरा जाते हैं कि यार 93 आ रहा है, कभी हमारा 82 आ रहा है, कभी 97 आ रहा। अरे उसको ये तो लगाना बता दो भाई। जो दवाई बेचने वाले ने, केमिस्ट ने तो बेच दिया, ये लो, अब बताएगा कौन कि कैसे लगाओ उसको।
करेक्ट।
दिस इज व्हाट वी आर लुकिंग एट। हमको ये नहीं पता कि ब्लड प्रेशर वाले को ब्लड प्रेशर देखना आता है कि नहीं आता। वो लेके ब्लड प्रेशर लगाता है, कहता है यार मेरा तो डॉक्टर साहब ब्लड प्रेशर ही बहुत कम हो गया, पता नहीं क्या खाऊं, और डॉक्टर ने उसको दवाई दे दी। और एक डॉक्टर ने दवाई दी तो दूसरे डॉक्टर से बिना पूछे उसने कहा तुमको क्या डॉक्टर ने दवाई दी थी, उसने कहा कि ये बताया था उन्होंने ब्लड प्रेशर के लिए, उसने खाना शुरू कर दिया। और देखा अगली बार ब्लड प्रेशर जब ठीक से लिया तो डॉक्टर साहब आप ब्लड प्रेशर ठीक लेते हो, क्योंकि उसको आता था। तो ब्लड प्रेशर का इंस्ट्रूमेंट तो उसको 2,500 का खरीद दिया हमने, उसको ये नहीं बताया कि कैसे लेना है उसको। ब्लड ग्लूकोज लेने के लिए उसको बता तो दिया कि ब्लड प्रेशर पंचर करो और उसमें डालो, लेकिन ये नहीं बताया कि कितना उसमें से ब्लड लेना है और कितनी बार मिसलीडिंग रीडिंग आ सकती है।
Absolutely, Dr.
So
Gupta.
I think we need to create basic education in the what we can call as an stakeholder.
Correct.
Stakeholder, finally, when you create responsible self-medication, your stakeholders are not the university professors or those who are attending this workshop or seminar here. Your because you can afford to give fees to doctor. Your actual stakeholders are rickshaw pullers, sabji wala, काम वाला, जिनको कि आपको educate करना चाहिए. So I am with you, but I am with you with caution.
Caution. Well noted. Actually, Dr. Gupta, you said the right thing, and very well voiced, because we've been always talking about this whole concept of responsible self-care, and within that, the biggest villain is the whole self-medication, because one really doesn't know, and a lot of consumers, still don't know so many things about it. And one side, of course, you do have the challenge of what consumer healthcare marketeers are always wanting to give that education, but at one point we also do have our challenges as far as a country is concerned, where the regulations are. So I'm going to go over to the next panelist, which is Mr. Atul Nasa. Mr. Nasa, I can't see you on the screen, but I hope you're around, because I'm just not able to see you, Mr. Nasa. Okay, great. Thank you, Mr. Nasa. So I think that we already heard from Mr. Ahuja, that Dr. Ahuja, that there is a policy coming, and that's going to be, hopefully we'll have something being seen very soon. But in your view, how do you see this whole self-care as a powerful enabler for the self-reliant movement that we are talking about? And I'm also going to add one more question, and in the interest of time, just wanted to check, what kind of support do you see from the industry? Because industry has been having, and that's how FICCI and Bayer are championing this entire this webinar. So in your view, how do you see this in our country?
Yeah, thank you, Susan, and thank you, FICCI and Bayers, for inviting me to this panel discussion. I was listening to the views of Dr. Otc Gupta and earlier panelist, and being a regulator, I just tell you this last 45 days, starting from 14th April even till day, lot of challenges, lot of issues related to use of medicines, misuse of medicines, self-medications. We face a lot of challenges. I agree regulations are well in place, but it is the moral responsibility of each and everyone, whether it is a physician, or it is a pharmacist, or it is a patient or a consumer. Everyone has to play an important role, an equal role, to prevent all unwanted situations. Now during this time, what we have seen, see, self-care is very important. I fully agree. What Dr. Gupta has told, it should not be self-medication, it should be irresponsible self-medication. I fully agree. Now, if you see the last pandemic, when ICMR has given one, guideline or, one statement that hydroxychloroquine tablet can be used for the prophylactic treatment, everybody started taking, SCQS tablet of their own. और गवर्नमेंट के पास कोई ऑप्शन नहीं था. They have to keep this medicine under the category of Schedule H1, not H, Schedule H1. It was a big challenge. Recently, you must have seen in the media that in Delhi, we have cancelled the licenses of 25 chemists. And today, even in Times of India, it has come that we have cancelled the license of 12 chemists in Delhi for selling the steroids, for selling the antibiotics without the prescription of a doctor. हमें ये क्यों करना पड़ा? Issue of black fungus. Now, in this category, at this stage, when the black fungus cases are on rise, we have to understand what is the cause, what is the reason. We were talking about tocilizumab injection, we were talking about remdesivir injection, we were talking about itolizumab injection, and now amphotericin B for black fungus. So it is 3 P's: physician, pharmacist, and a patient. सबको सोचना है कि हमें क्या करना है, क्या नहीं करना. We have seen the cases. I am sorry to inform you. We have seen so many prescription from the doctors during this pandemic time. Irrelevant prescription, no signature, no date. Bring remdesivir injection. Bring 6 injection. Who is writing this prescription? God knows. Acute shortage and tremendous pressure. Prescriptions are well defined under Pharmacy Act. Prescriptions are well defined under Drugs and Cosmetic Act. Prescriptions are well defined under Medical Act. So we have to see what is a proper prescription, how to dispense a medicine. But definitely, one common quote is there: health is wealth. If we are healthy, nation is healthy.
Correct.
And our honorable Prime Minister has given a statement: Self-Nirbhar Bharat, Atmanirbhar Bharat. This is his, vision. This is his vision. So we have to understand, for staying healthy, there are certain parameters, which is not impossible. General parameters are, staying healthy, that eating good habits or good foods, doing some exercise, some yoga, some meditation. But on the other side, avoiding self-medication. That is utmost important. That is utmost important. Dr. Gupta was rightly telling that we don't want to go to a doctor because we have to spend 500 rupees or 1000 rupees as a consultation fee. And on the other side, we're starting taking these medicines like antibiotics, like painkillers, like habit-forming drugs, like steroids of our own. Once any such directions or some in media some information comes, but that self-medication is how much dangerous we have to understand.
Absolutely.
But particularly the medicines which are prescribed in Schedule H and Schedule H1, which are only to be sold on the prescription of a registered medical practitioners, each and every body has to understand. Aside OTC medicine, regulations are coming. We agree whether it is paracetamol or vitamins or nutrients. There was a news in the media also that how much zinc is harmful during this pandemic time.
Yeah.
Because
Absolutely.
people started taking ginkgovit and zinc preparation of their own कि हमारा immunity बढ़ जाएगा. Though zinc preparations are not covered in schedule, category, but even then they are harmful.
Yeah.
So
Absolutely.
whether it is antimicrobial resistance, whether it is black fungus, whether it is immunity issues, we have to take a challenge. We have to think from a broader perspective that what we have to do and that what we have not to do. So my submission here is definitely self-care is very important in all sphere, whether it is hygiene, whether it is meditation, whether it is medicines, whether it is following any guidelines coming from Government of India and from different departments. And your second query, what we expect from pharmaceutical industry. I tell you, pharmaceutical industry played a very important role during the pandemic time. And only challenge was active pharmaceutical ingredients, APIs, which are used in the production of any formulations. Earlier, we used to be getting these, APIs from China. But during the last pandemic, it was a message for the entire pharmaceutical industry, particularly the API industry, that we should not depend on the import of APIs from other countries, and our API industry should be well strong that so that we can manufacture our own formulation and APIs in our own country. So that was a good lesson to all the entire API industry. We should not depend on the import of these APIs from other countries like China. And second thing, when this pandemic came, all of a sudden demand of Covishield, Covaxin, and all COVID-19 treatment injections. Though DCGI was kind enough to give the permission in a very short span time during the 8 months time to go for the Covishield or Covaxin or any other related injection for the treatment of COVID. But our homework should be such a strong homework, like in the case of black fungus. Now, black fungus is a rare disease. Amphotericin was not in demand. And today the situation is we are not having enough, amphotericin B injection to treat a patient who is suffering from black fungus. One patient is requiring 50 injections per week. And in Delhi, we have got 800 patients requiring 40,000 vials per week. And we are only having 4,000 vials. Patients are dying. So this is, we have to understand, particularly pharmaceutical industry, that our homework should be in such a way that buffer stocks, particularly any such rare disease comes. So we should be able to control that. Production should be well planned, and so that there should not be any shortage. In all the cases, even in the case of tocilizumab injection, that is the only one company, that is Cipla, which is importing this injection from Switzerland. No other company is manufacturing tocilizumab in the country. This is a shocking news, surprising. So we have to understand whether it is tocilizumab or itolizumab or amphotericin B, which is in high demand, pharmaceutical industry has to plan in such a way. And then pharmaceutical industry under CSR schemes, they can arrange some, consumer awareness programs. They can have academic, industry interaction. They can conduct some educational awareness program with some pharma associations, and their research and development section, R&D, should be strong enough. Let us work more on R&D activities as compared to the production activities. This is my submission.
Thank you, Mr. Nas. I think very well taken. Your points are so valid, because every time we as from the industry, they have been coming forward, and they did extremely well when it happened during the pandemic. And one very important point you mentioned about how do you create the whole ecosystem to start propagating responsible self-care, and in that the pharmacist makes a lot of difference. So over to you, Manjari. Dr. Manjari, I'm sure, I know we are going a bit against time, so I love to keep this a little more short, but just wanted to take your views, because you've done a lot in this space to see how pharmacists can, start helping the self-care movement. What are your views, and how do you really see this becoming an empowering pillar in this whole self-care space?
Thank you. Thank you, Susan. Thanks to FICCI for this opportunity. Happy to be in this panel discussion. Honored to be invited. So looking at the time paucity, let me tell you that we are on the same page, and everybody is looking at the pharmacy as having a lot of scope and potential for responsible self-care. And the pharmacists are the first port of call. I mean, they are so close to the community. They're open. Their access is there. They are not charging any fees for consultation. So all this makes a pharmacy as an ideal setup for the self-care and responsible self-care. And especially in the rural area where we don't have healthcare workers or we don't have doctors, the pharmacists are very ideal. So if we have to go for the last mile delivery, reached, unreached, and if we don't have to leave anyone behind, pharmacy is the answer. So these are the human resources we need to utilize, and I have a lot of positive experience working with the pharmacists, how they can help the patient. And the health literacy is a big gap. But when the pharmacist educates the patients, I mean, they can really give a good guidance so that, there is a expected health outcome. But there are many challenges. I mean, having said that, I have good experience of the pharmacist doing this job. There are many challenges if we look at the entire India with more than 8 lakh chemists. So the education of the chemist is a big thing that is needed, empowering them with right education, creating an ecosystem so that we can provide, a lot of digital tools to the pharmacists, in turn, which can be used for the consumers, creating a lot of posters, infodemics, literature for them, maybe digital or in actual form. That could be very, very helpful for the pharmacist. Having the list of OTCs, and not only OTC list, clear cut, but also with the patient package inserts and the correct labeling for consumer information, consumer education will be very helpful. That will in turn empower the pharmacist, because otherwise patients do ask for many things without prescription, but we need to have a good patient package insert along with the product, and having the regulations in place. I mean, regulations are there, acts are great, but the implementation part has to be there. So that the prescription drugs are not sold without prescription. And if one pharmacist wants to stick to ethics and the act, the other pharmacist may not. So in turn, everything, the entire system gets spoiled. So the regulations have to be enforced very well. And I think industry has a big role to play in this along with the pharmacists. Also, interprofessional collaboration is very important, and creating awareness that the pharmacists are important pillars of the healthcare system among the consumers, among the other healthcare professionals will be really, really helpful. So I see future of self-care or responsible self-care very bright, with the pharmacist taking lead in it and stopping the irresponsible self-medication, as well as helping in the health promotion and disease prevention, as their global counterparts have been doing.
Fabulous. I think, Manjri, you mentioned a very interesting point, because earlier Jurate also spoke about this, and she gave an example of how a company launched a self-care manual for pharmacists. And they actually put that effort in training. And I think this is a conversation which, again, from an industry point of view, how do we empower our pharmacists? Because they really can bring that advisory role. They can take a lot of pressure from the doctor. And like Mr. Nasa mentioned about the prescription, the way they kind of honor the prescription, or they see an opportunity to recommend certain self-care products in the absence of in many cases when consumers go to them. So they have a huge role. I think this is something we need to work a lot on, and it'll be a happy space to be in. Definitely. And this brings us to our last panelist. I'm sorry, guys, we only had 45 minutes, but this is a conversation which needs a lot more time. So we're just kind of touching a few of our stakeholders, and here is where the nutritionists come. Dr. Awula, you represent the nutritionist community, and we're a country today which is really understanding nutrition in a big way. People understand today what a zinc is, what are nutritional deficiencies. Immunity is the buzzword. So again, from your point of view, how do you see the role of empowering consumers on the knowledge of nutrition? Because even anything in excess, so if someone is taking zinc excess or vitamin D excess, it has a challenge. So from the nutritionist community, from your own perspective, how do you see this, in managing a much better responsible self-care movement in our country?
Thank you, Ms. Susha. Thank you. And good evening, everyone. And also congrats and thank you for all panelists. And they have spoke very well with the present context. So nutrition is very, very important, because nutrition and health we cannot separate. Nutrition leads to health and health leads to nutrition. So the nutrition is very, very important in the present context also, because of this we are facing in a COVID pandemic situation. So we have, is it audible, my voice?
Yes, very much, very much.
So we are facing a triple burden of disease because we are facing undernutrition as well as micronutrient malnutrition, that is a hidden hunger. And the third one is NCDs, non-communicable disease, and we are facing an epidemic of non-communicable diseases like hypertension, diabetes, and these are all very, very important in the context of COVID also as a comorbidities, and the patient severity and long stay in the hospitals, all leading to comorbidities. And these are all because we with the self-care itself, we can manage these things, and the food is very, very important. And the one of the even Lancet publication recently says that the important risk factor for many diseases is unhealthy diet. So the unhealthy diet, it is a modifiable behavior, and that can be done in a correct way. But here also, even food consumption or food intake also, the self-care is very important, and responsible self-care. Even Dr. Y.K. Gupta also mentioned, and everybody agreed that the self-care and responsible self-care is very, very important in the context of nutrition also. Because even the FSSI, you might be knowing the FSSI, Food Safety Standard Authority of India, is also launched long back a food labeling. In 2006, they launched food labeling, and it has been now it is an act, but unfortunately the implementation is not there. And we have conducted several studies on food labeling behavior of consumers on food label. So we are very shocked that, and we have examined more than some 2,000 consumers at outlets, and in almost 4 cities in Hyderabad, Bombay, and Delhi, and another one is Madras, Chennai. So surprisingly, we found that 85% of consumers they usually check only best before date and the price of the product. So, but lot of nutrition information is there, but no one is ready to look nutrition information, because nutrition information is a mandatory now in food labeling. And actually they are supposed to see what is the percentage of fat is there, what is the trans fats are there, how much calories are there if you eat that particular packet. So this kind of literacy is very, very important. We always say that even literate people are illiterate. So the nutrition knowledge is, they may not have much nutrition knowledge, and always, so everyone need nutrition knowledge. And Dr. Y.K. Gupta also mentioned that the knowledge is very important, knowledge, awareness, and practice. So these things are very important. And fortunately, even in a COVID pandemic situation, and 70% of cases are non-symptomatic, and then another 20% is very mild. So these are all mild symptomatic patients are taking a self-care or home isolation, and they are now thanks to even corona, so much self-care practices are coming to picture, and especially non-pharmacological measures, especially the hand wash, and then the food safety issues. These are because even if you spend billion rupees also, this much awareness and this much practice you will not get, but the corona got it. So so it is a good thing is in a bad situation, but this is what's happened now. Everybody wearing a mask. If you impose any fine also, this will not happen. Now everybody, most of the people are wearing mask, and social distance. These are the some of the measures of even self-care. And now the self-care they manage with their nutrition. Now if you see because even somebody told that Atmanirbhar Bharat in every aspect, in food, agricultural production. If you take, we are agriculture production in fish cultivation, we are number one in the world. Milk production, number one in the world. But unfortunately, the utilization or consumption levels are not up to the mark. So because in National Nutrition Monitoring Bureau, we have surveyed several rounds of diet and nutrition, and all these surveys shows that the consumption of fruits and vegetables, the consumption of milk and milk products, and consumption of protein or pulses is very, very less as required for a person. So again, because this is not always because of poverty, because food is available. Okay, food is available, accessibility is there, affordability is there inside, but very few section of people may not be affordable, but most of the people, the affordability is there, only selection is the main problem. So the awareness. So today we are rightly discussing here that the awareness, creation of awareness, even nutrition is very, very important in this context. And even even in WHO report recently released, 97% of morbidity indirectly or directly we can reduce with only sustainable healthy diets. So the sustainable healthy diets are very, very important. And this only consumer cannot eat alone, because this is a chain of the systems. The production should be there, accessibility should be there, availability should be there, and affordability should be there. And at the same time, the empowerment of consumers, knowledge also very important. Then only we can achieve the good health, and we can improve the human resource in India. And even Prime Minister also several times, and everybody is talking about we have a demographic dividend. Until unless if you utilize a good nutrition, we cannot see the healthy people, and we cannot achieve the goodness of the demographic dividend. Thank you for giving this wonderful opportunity, and thank you for Picky and other associated Bayer and other companies, and Picky especially, and Dr. Swati, Susha. So I'm very thankful for giving this important occasion.
Thank you so much, Dr. Abula. And I'm standing against the next session. That's why I won't be taking more time. But I think from a wrap up, certain keywords which came up today in this panel discussion was all about responsible self-care, self-medication. I mean, I know we talked about self-medication being a bad word, but I think what is interesting to see is how do we make it into a more confident word by adding the word responsible. And responsible means health literacy, knowledge, awareness, because if everything comes together from an ecosystem point of view, I'm sure we are really in the midst of using this into our advantage and actually benefiting our country, because all of what goes back is into the economic value. Thank you once again. Thank you very much, each one of you. I'm so sorry we don't have much time for questions. We would have had like I said, this is a very passionate topic. We can go on and on, but I would possibly hand it over to Swati so that we can go on to the next session. We have, time up to 5 o'clock, and we have a very interesting session coming up. So I would just hand it over to Swati. Once again, thanks, Vicky, thanks, Bayer, and thanks to all.
Thank you, Susan.
Miss Swati, I have another meeting at 4:45, so I will leave if you permit.
Sure. Thank you, sir, so much for joining. Thank you so much. So thank you to all the panelists and Susan for a wonderful discussion. It was indeed very interesting to hear all the perspectives. With this, we now move on to our next element of the conference, which is the value creation, where we'd like to have your attention to this special session with Patricia Corsi. Patricia Corsi is Global Chief Marketing and Digital Officer at Bayer Consumer Health. After spending over 2 decades transforming brands and ways of working in blue chips, FMCG for multi-million-dollar brands, she decoded what truly drives consumer attention and love, recruitment and sustainable growth. And it's not the new shiny object, but being genuine, mastering solid fundamentals, and focusing on consumers and customers. It matters how deeply you connect with the heart-beating people you're trying to help and communicate your message, and how authentic your message and your purpose comes through every touch point. Ultimately, her goal is to deliver shareholder value and have a positive impact in the world, not one or the other. Patricia has built a career in different geographies and categories, having lived in Brazil, UK, Holland, Mexico, and now Switzerland. We welcome you, Patricia, for this session on value creation. Along with Patricia, we have Ms. Charu Agarwal, the Chief Strategy Officer, India and Southeast Asia, Havas Group, a sharpening scholar awarded by British Commonwealth. Charu comes with 20 years plus experience in shaping brands, digital and media innovations on Fortune 500 brands like GSK, Bayer, P&G, to name a few. Welcome, Charu, and over to you to begin this session.
Thank you so much, Swati. Welcome, Patricia. It's lovely to see you. And one thing I must say right at the beginning, I think we had like a really wonderful panel that just ended. And I think one of the big things that came off that session was this whole notion of responsible self-care. And I think that's like a perfect stage for us to begin our conversation, Patricia, which is basically when we talk about, establishing a self-care council. It would be really interesting to understand from your perspective, what is this council all about and how are we trying to create that impact, or how are we trying to build that impact around responsible self-care in India?
Because first of all, good afternoon, everyone. It's a pleasure and an honor to be here. And indeed, Charu, I agree with you. I was hearing in this responsible self-care, and it's good on two ways. It's responsible because it's making sure that people have the responsibility to make sure that they are really doing the right things and talking to the people that know, the pharmacists, the doctors, whenever needed, but also the own responsibility that people start taking on their health. And I think the COVID lesson that has been hard on all of us. So I'm from Brazil as well. My country is suffering a lot with COVID at the moment. Like we have seen things happening in India as well. And we have to think as soon as the crisis is over on how do we take the lessons on taking proactive care of our health versus reactive care. I think this is also part of being responsible about our health, right? Because in some cases, and the team was amazing giving me the statistics on so much hard work happening in India and people not being able to be one day out of work. And this is also compromising how many peak working years they have. And I think taking this responsibility to know that your family is counting on you, that your friends, your colleagues, your company is counting on you. So therefore, you should proactively be responsible about your health. I think it's a new thematic for all of us.
I absolutely agree, Patricia. This entire thing about reactive versus proactive, I think is a very interesting differentiation that we all need to realize. I think Sandeep, right at the start of the conference, had mentioned some statistics around India, which I would call a little bit shocking, but yes, as an Indian, it's not shocking because they talk to me. It's like India is one of the tops in terms of the most workaholic nation, and we tend to forget about the health niggles or disregard the health niggles. I think in that kind of a scenario, that realization of proactive self-care is extremely important. And I think I will probe a little bit more, Patricia, in terms of when we talk about proactive self-care, why do we feel it's extremely important in a market like India, or how can we actually shift that gear? So what for the first question is the why, maybe, and I think let's focus on the why first, and then we'll get into the how.
Yes, so first let me just do a small comment that I was also shocked when I saw those. It was really insightful, but the next thing you think is that we must do something because this is not right? So I think I think the team was really smart because they brought a mix of shocking facts with call for action facts, because it's something that you see and you cannot stand on your feet without doing anything. And the additional thing that I want to put on this mix of statistics is that India is one of the youngest countries in the world. So when you look, I think the last time I looked, around 50% of the population was around or lower than 26, 30. That is much younger than countries like China, for example, where, so Indian people have a younger population that is working much more when compared to what would be a similar size of nation like China. So this is really important in the context of younger people tend to be less careful and less responsible about their health. And that's why I wanted to bring this, because we were just hearing about the, science says that to get, for example, the amount of vitamin C you need in a day, you probably can't get hold of eating so many oranges. It's there is so much you get from your nutrition if you have the possibilities and means to have a really healthy, well thought nutrition. Yeah. So there is a role that we can play to help from the nutritional point of view, because we know people that are well, within their nutrients, if they have the right amount of iron, phosphorus, calcium, vitamins D, E, K, they perform better. So I think it's important to put this together with how young is the Indian population and how this is not on the top of mind. Yeah. And I see my son, my son is almost 13. His health is something that is completely off the table for him. And if I remember myself as well, I think there is this sense globally that we are invincible, isn't it? Because I think this is the good and the bad of youth, that we think nothing can stop us. And that's why, talking about your why, that's why this initiative is really important. Because if we manage to change this behavior for better, when people are younger, we know that we have better chances that they are going to grow up taking care of their health for much longer, and they will raise their kids or they will spread this knowledge with their friends and family, and the whole systemic change happens. Because this is not an individual change, right? So we are talking over 1 billion people. So if we don't have a systemic change, we don't make change. And that's why, talking about your why, I think it's important. So the role that that's why, since I first saw this idea from the team, I was a super big fan of it, is this cannot be done alone. And I want to paraphrase, because in the Federation of Indian Chamber of Commerce and Industry, there is in the LinkedIn profile, there is a say from Gandhi that I think is exactly, it's a wonderful paraphrase for that, is by, the industry should regard themselves as trustees and servants of people. In that one is saying of the poor. I think for us, I think the paraphrasing is of the people. And if we do it with the younger people, we do it for the generations to come.
That's very well said, Patricia. That's very, very well said. And I think this entire notion that you talk about, which is true, I'm guilty of it as well. As young, we feel we are invincible, and the first thing that goes off the table is health. And I think that equation, I think, is somewhat distorted, in the sense of, if we are proactive about our health, we can be more productive for longer. And therefore, the economic impact will be much bigger on self. I think that equation has gone sort of missing. And I think if we can build on that equation, maybe the systemic change can happen. I'm not agree faster, but I think we can move towards a systemic change, if you will. So I think I find that quite interesting. And I think dipping a little bit deeper into the relationship between productivity and economic impact. I had seen a study from Bayer itself, where there is actually hard data on the fact on if the population becomes more responsible towards self-care, that would lead to significant savings, not just for self or the individual, but also for the country as a whole. And you did have statistics from Mexico saying that it could result, if people were able to address simple ailments, simple small ailments, like even a common cold, for example, effectively and properly, not like irresponsible self-care, but with responsible self-care, then it could lead to almost like a saving of $67 million for the entire healthcare system. And I think the figure is amazing. It's like a really big amount when you think about it. And if we can translate that for India, that would be phenomenal. And that's where I would want really some learnings. If Bayer has been working in other markets, if we've been creating similar programs, it would be lovely to hear some insights and some learnings from there on how we could deliver that.
For sure. And I fully agree with your comments about the important role that this has for the economy, not just for the individual or for the companies. It's a really positive impact on the economy. And, you know, some of the things that we don't discuss is health for some countries is one of the biggest funds pot and one of the ones that are most unfunded. Because the other thing is, the more you treat people, the longer they live, the more you need money later on. And it's important that the countries prepare for later on in life when some of the ailments that come are not, you know, the ones that you can treat yourself responsibly. Yeah, because it comes with age. And I think this is important, that the breathing space that self-care responsibly can give to the governments. So one thing that we have a research on, Shadow, as well is, and we did this research globally, there are 3 basic things that affect people daily that stop them from really performing well or from performing their best or even going to work, that really has effect on their families, their income, and their possibilities of having a better life. One is, as you said, a common cold. It's a common cold is something that can be treated, you know, with medicine that is in the pharmacy, doesn't need, you know, to be performed by a doctor. So this is one. The second one is headache and body ache. This is something that can stop the person on their tracks. Someone with a big headache, you know, and I remember last time I was in India, I think I was a bit jet lagged, and I had this headache, and I had the chance to have an oil dripping on my forehead. And it was a really interesting feeling, you know. And then I took my medicine, I took my Saridon, and then I was tip-top. And I went to my meeting and I was super productive. So some of those things that helps you to be at your best, probably if I took a tea and waited, I would get eventually good, but I probably would have lost that day of work. And sometimes you cannot afford to lose a day. And the third one is stomach aches. So sometimes, you know, life is already very hard and we indulge a little bit. We eat a little bit more here, we eat a little bit more there. And that is not something that you need a full treatment, that is a chronic disease. It's a bit of a dyspepsia that with a simple self-care treatment, you can take care of and you go on and live your life normally. So these are 3 examples of responsible treatment and self-care with products that are available with years and years of clinical study that shows the safety, shows the efficacy, where people can see and can act on themselves. So there is another point that you were asking about the examples and the experience we have. One of the things that enables that is for the industry to also be very empathic with the price points and the size of the packs that consumer can buy at that moment. Because I may have a headache today, I don't need to buy 20. I just maybe need 1. And by the way, I just have a change. Yeah. And it's important to have this connection of the brands and the consumer. We are here to serve them. Yeah, and there is space for the larger sizes, you know, big families and other things. And when it's prescribed by the pharmacist or the doctor that you have to take it 2 weeks, all good. So these are things that we can see that has an immediate effect on economy. And we have 30% people that are absent of work in other countries because of one of these 3 things. So this is effective people not working, not earning, because in some of those cases, most of those people are not registered employees. So if they don't go to work, they don't receive that day, they don't have food that night on the table. So these are the aspects and the numbers that we have to share. But clearly, there is such a big correlation about responsible self-care, awareness, an economy that is undeniable.
Yeah, I agree. And I think this entire notion of leveraging the right knowledge that we have, in all our Ayurveda and all our homeopathy and all the things that we do, and walking that balance with, if you need immediate relief, what else can help you alongside everything that you're doing right for your body. So at the end of the day, it is about your body, but it's also about the economic impact and the productivity. So if it fails you on your important meeting, then yeah, you need to do something about it. And I think, how do you walk that balance, and how do you know enough, or rather, how do you know the right information to be able to walk that balance? I think that's a really interesting space. The second thing you said, Patricia, and which also I think a lot of panelists were talking about, was if you want to drive a systemic change, you need to talk to the rickshaw pullers, you need to talk to the workers, who will feel that loss of daily wage. And I think your point on access and providing like a single dose, or providing that low value, I think is extremely important to drive that proactive self-care agenda, because you're talking to people who may not have the means. So one is educating them, but it's also then giving them the means or the access to the right products at the right price point, which is quite interesting. And I think that sort of talks to another point, which is when we talk about this entire notion of right information. I think a lot of people mentioned the WhatsApp University. Sandeep also mentioned it. We heard it across throughout the entire day. I think one thing that COVID has done is it's accelerated the digital adoption, but it's equally kind of opened up this sea of information, which people do not know how to navigate. So my question to you is, again, is there any work or any global insights that will help us activate the 3 pillars that Sandeep spoke about? So if the 3 big pillars are ask, know, and act, which is how do we get them to ask the right questions? How do we get them to know enough? Any examples that will help us activate those pillars a little bit better?
For sure. And I'm glad that we are talking about education, because this is such an important role for us. And we cannot deny that, sorry, I stopped seeing everyone. So we cannot deny that us as brands have a disproportional role to play on education. Sharo, we are in the same area, and I'm sure, in the past 5 years, you have seen the statistics that people had their lowest trust in brands until COVID for decades.
Yeah.
So brands have lost their ability to create this relationship with people, because people were not believing brands anymore. Interesting, I just saw a report from the WFA, the World Federations of Advertising, that was done globally, that after COVID, people are looking at brands for help in terms of education, in terms of guidance, in terms of instruction. And that's why, for example, one of the first things we have done, we have relooked at our websites, because this is the first free space of information that we have out there. The second thing that we have done is we focus our educational campaigns on the new, more modern ways of communicating. So, for example, we have a big campaign in Brazil that is really focusing on education and empowerment on women intimate health. And we are using TikTok. And through TikTok, we have delivered 17,000 classes on education, from chemistry to psychology to economy, 17,000 classes in 3 months. And this is the power that I see in this self-care council that the team is putting together. Imagine, and this is one brand, 3 months in Brazil alone. Imagine what can be done in India with this initiative. And that's why it's so important to have everyone rallying around it. And I wish I could say in your own language the name, the rally cry, because I think it's fantastic. The rally cry to strive forward, to strive for India, it's amazing. And I think it's a great opportunity now more than ever for companies and brands to show their colors. Lots of people talk about purpose. Lots of people talk about living their purpose. Now is the time to show that everyone is rallying together for the best of India. And by the way, this initiative that I mentioned in Brazil, we are doing the same. We are looking for partners in all the industry to say who wants to go with us, because if alone we could do 17,000 classes, imagine with what we could do. We have achieved 70% of the women population within the age group that we can help.
Wow, that's like a vision itself, right? For everyone over here to look at the partnership that could actually drive like a big initiative in India. I think you actually excited me. I'm like, I'm in. But anyway, but I think it is super interesting. But I think what you've said about using the right medium, a medium which everybody is using. Yes, we don't have TikTok in India, but what's the alternative mediums that we can use?
Exactly.
Just ensuring that the education reaches the right people, and then activating the access, the right product at the right price point, I think really, sets up the package. And I think if we can get the right partners, which is what this entire Self-Care Council is about, it's not just about driving a systemic change with one organization, but literally driving it in a way where everybody can come together and collaborate. I think it's fantastic. Then only Sehat se badega India. Patricia, I'm doing it for you. It is really and genuinely the motto that we want to carry forward, and genuinely believe in making it a reality. Okay, given the time, I'll wrap it up because I can see Swati on the panel, which means my time is up. I would love to carry on chatting, but any closing words from you, Patricia?
Well, look, first of all, it's an honor to be here. Thank you very much, and especially thank you, Charu, Sandeep, and the team for all the work that you have been doing on this, and Charu for this fantastic duo that we did here. I want to also thank the Federation of Indian Chamber of Commerce and Industry. Such a legacy, institution in India, and it's fantastic that we are partner with you. And look, everyone in this call has donated their time because they're passionate and engaged about this initiative. And for me, against this ambition, with a passionate team, with a team that is driven for the greater good, I truly believe that there is nothing that can stop us. So my rallying cry is, go, if you're watching this, go and connect with our team. This is an initiative for India. Don't think what is the logo behind it or not. Think about the people that we serve. And I know that with that in mind, we are going to be extremely successful. And I'm really looking forward to the day where I can get on a plane and go to India and see that initiative in place and celebrate with the team, because I know it's going to be a big success.
Thank you so much. Thank you so much, Patricia, for those amazing words and for pumping up the whole team to drive it forward. I will just thank everyone. Thank you so much. And thank you, Bayer and Vicky as well. And it was lovely chatting with you, Patricia. I will hand over to Swati, and let's go to the next session.
Thank you very much.
Patricia. Yeah, please. Thanks, Patricia and Charu. I'm sure this initiative of Self-Care Council will provide impetus to the self-care revolution in India, and all the very best. Now, as we move forward towards the end of the conference, I would now like to invite Mr. Praveen Kumar Mittal, Senior Director, FICCI, to summarize the event and present the vote of thanks.
Thank you, Swati. Thank you so much. I hope I am audible to everyone. All right. So first of all, distinguished speakers, industry colleagues, it's actually an honor to be joining you all for this webinar on the self-care for self-reliant India. So promoting responsible healthcare and health-seeking behavior helps actually introducing the overall burden on the health system and reduce the health expenditure of the families. It reduces the clinical visits and lower the hospital costs. Information, education, communication plays an extremely important role in helping people make informed health decisions and self-reliance in bridging the knowledge gap. Opting for point-of-care devices should be actually encouraged. Digital health, telemedicine consultation, technological advancement actually will help in the last mile connectivity. Pharmacists are important key links in the healthcare systems and should be strengthened. Self-care and appropriate health information seeking behavior should be practiced as a part of the new normal in daily life. So, when it comes to proposing the vote of thanks, I would say that I'd really like to thank Dr. V.G. Somani, the Drug Control General of India, Dr. Y.K. Gupta ji, President AIIMS Bhopal and AIIMS Jammu, and he's the Vice Chairman for Standing National Committee on Medicine and Healthcare Products, Mr. N.K. Ahuja. Let me share with everybody that they were all super busy, and the way they have been able to take out time for us today has been really encouraging for the industry. So my, thanks to them. And of course, to the expert speakers, eminent dignitaries from overseas, doctors, healthcare officials, and of course, patient advocates. Mr. Sandeep Verma spoke about the importance of self-care in today's times, which reduces overall stress and burden on the country's healthcare system. Ms. Jurate spoke very judiciously on the various initiatives in Europe and how we can learn and use the best practices from there for India. So that also helps. One of the key points that I would say is Dr. Somani emphasized on the need of self-care for COVID prevention and later. So that's extremely, extremely valuable, important point. And of course, Ahuja ji, who provided us the updates on the OTC guidelines in making and how OTC is a double-edged sword he spoke about. But he also emphasized on how all pathies should actually come together to fight the pandemic and practice self-care treatment under telemedicine. Can't thank Arun Mishra ji enough for agreeing to be, doing the Fireside site for us. Thank you, our partners, Bayer, Mr. Sandeep Verma. Thank you so much once again. And thanks to my colleague Swati, who, because the healthcare team at FICCI is, really serving the entire thing on healthcare and also helping, the country officials and everybody in putting up for the industry the representations and the recommendations. So Swati has been really running from post to pillar and the way she's led it from front. So thank you, Swati, once again. And I would like to thank everybody who joined us in this interesting session today. And thank you once again. Have a nice good evening. Stay healthy, stay safe. Over to you, sir.
Thank you.
Need lots of insights here, and I'm extremely glad for being part of this conference. I once more thank all the speakers and the participants who were there with us, who joined us, took out time. And with this, I announce the closure of the conference. We wish you all a very good evening. Stay safe and stay healthy.
Thank you. Thank you, everyone. Goodbye.
Thank you.